chose a project where we know three mechanisms sort of exist, and there's some work going on. So step one of the research says, are mechanisms in these three benchmarks there, and are they functioning? That means, are they being used by the community? Yeah. Whatever tools we have, whatever mechanisms we have in place, are they being used? Are they making a difference? Step two of the research takes that one step further. It's basically looking at relevance, effectiveness, efficiency, and sustainability. So we're defining quality using the DAC criteria, 4 of the DAC criteria, and we're saying if we have information sharing mechanisms, participation, that's called mechanisms, and complaints handling mechanisms in place, and if they are functioning, what is their contribution to program relevance? What's their contribution to program effectiveness, efficiency, and sustainability? Yeah? And this is happening between Save the Children, HAP, and Christian Aid in Kenya and in Burma right now. Kenya is with Christian Aid, Save the Children in Burma. Kenya has just been done the field work. Burma is starting next week. In April, we hope to have results. In June, we hope to do a launch event and some publications, if, of course, we have evidence to show. Yeah? This is our accountability impact research. So, watch this space. All right. Morning. Welcome to the information sharing. And this is a very kind of simple section. I can spend some time presenting to you different tools used in our different country programs to share information with children and carers. But I think what could be more useful is actually having a discussion around some of the newer technologies used to do that. And I had asked Sophie Martin-Simpson to come and join us to talk about the Day4 project, but she's not probably going to make it. And when we were discussing this, Hassan said he has some information on that. So I thought, why don't we start with just looking at the basic guidance on information sharing. What needs to be shared with communities, and we can have a quick discussion about, is this happening, what are the challenges with that? And then we turn over to Hassan to share some experience on some of the newer technologies. And I haven't seen this, so we will look at it together for the first time. We'll try to keep the presentation short, but really ask you questions about what you know. And if you don't know the details, if you don't know, that's fine. It's just really for us to get some exposure. So that's kind of the first session, yeah? And then we start looking at accountability to and with partners. And that's a very, very important session. We'll do a little assessment, and I'll show you a presentation of how to mainstream accountability across the program cycle. Before lunch, if we have time, we'll look at a short film from Myanmar about staff competencies for accountability. We go for lunch in Rendezvous, and then we come back and we have a discussion around the film and what issues it brings up. I really like that film, and I hope you will enjoy it. We have speakers, so I hope it will be a nice kind you won't struggle to hear things. And then in the afternoon, the last session is accountability and child safeguarding. And for these 2 sessions, I think we will have Bill join us, Sophie might come in, and also our Deputy Director of Child Safeguarding, Christine Lipohar, will be here. And it will be very important to have her here because in the afternoon are when we will be looking at the staff code of conduct, staff attitudes and behavior, and what that means for accountability, and then safeguarding issues, and also reporting on, safeguarding issues, and how does that interlink with our accountability mechanisms, especially complaints mechanisms, and so forth. And I think we're very lucky to have her. It just happens that she is visiting in London, and she's kind enough to make time for this. So, and she's great. So, I look forward to those 2 sessions. Does that sound all right? Okay. So, information sharing. If you have still your blue folders with you, do you? There's 2 key how-tos. The first 2 how-tos on the left-hand side. How to share information and how to share information about project budgets. I just want us to go through this and then have a discussion and then start listening to... Do you have it? Okay. For those of you who have seen it before, and those of you who are looking at it, there's basically, the principles are simple. We need to share timely, clear, relevant, accessible information for different audiences. And we need to share information on our organization, project, and how people can be involved in the program. Yeah? So that if this is a checklist. This checklist is basically organized along those 3 sections. So if you were to go through it, tick for yourselves which pieces of information you think basically are shared and which pieces of information are not usually shared. And we can have a quick discussion about that. Do you have it, Gloria? Yeah, so just go through and tick if you think that these pieces of information are being shared.
Why you choose some people, not others, without saying you've chosen without patronising people you choose, but you also want to avoid isolating people.
Yeah.
So how to manage that process?
Yeah, that's always a tricky one. Any reactions to that or any other comments?
Once we were discussing that to share the budget information with the community, like the major checks. And then the reaction was that normally there is some, like, not all the community is positive. Sometimes there are problematic people. And then they say that why not, this budget is for us, so why not to give us to us? We will manage.
Yeah.
Yeah, this is some...
That's the sort of reactions that you get. Okay, excellent. Any other thoughts?
I think these are all very good things to share, but that depends on the context where you are working. Like some countries where security situation is not good. We cannot share all this information.
How much of that is being shared in Somalia, for example?
In Somalia, I don't think that we can share budget information and funding situation for obvious reasons due to security situations. But we briefly tell them that what we are going to do, how we are going to do, and what will be the services. Because, especially as Nasir mentioned, this funding issue is very critical because there are militias or influential leaders. If you reveal this information, so they will try to influence. So, and it's not very easy because even the local administration, they will give you some areas where they have their own people, and they will try to divert, funding towards their own people.
Yeah.
So normally, it is not. We do not prefer this to share the funding sort of.
But they know us. We put logos in.
Yeah, we are putting logos.
Yeah, so it's not like Pakistan where we couldn't even do
But
that.
there are three parts in Somalia. The Mogadishu is the most sensitive part, where we are working. Even we don't have access, we don't have direct access.
Right.
So we are working with the partner CPD and two others. But there are two other parts which are comparatively calm and safe. Where we have logos, where we have everything. One part is just like Pakistan. We don't share. Even we don't say that we are digital and stuff. Nobody from our office, if they have to go there, they have to take approval from CD or something.
Right, and when you are in there, you travel with what sort of cars do you travel in?
I haven't been able to travel to Mogadishu because of the security reason, but the second peaceful part of Somalia where I have traveled, they have two vehicles, one in front and one at the back of you, if you are international, with 4 special protection units. So again, you are very much visible, you are very much
But the cars aren't branded.
Cars are police cars.
Police cars?
Yeah, and you are in the middle. They are in the uniform having a gun. So it's not very easy to interact with communities or children. So this is very challenging for safety children. And that is why we are doing this telephone and hotline system. We are trying to strengthen remote monitoring so that we can hear them. Because if you will go, definitely you will interact with the community leaders, with community elders. You don't have access to common people. And even the common people, they know that you are coming with SPU and you will go away, and then they will be again dependent on the community leaders of the family. So there are something which is very challenging to get voices from ordinary people, children, women. The same is the case for information sharing. Like we are trying to improve this aspect of what kind of information we should share, or there are pros and cons for.
What do we help our partners to do in this area? How much information do they share on our behalf?
The recent feedback and things that we have taken from directly, that was totally different what our partner was saying. They don't have very good information. How this has
Also, they don't have very good.
They don't have,
And the partners, how often are they in the community? How good is their access?
Yeah, their access is very easy, and they can easily move because they are from the same clan, same community. They can move, they can work together. But regarding safety children, we need to improve our relation.
Okay. Right, thanks. Coming back to the checklist, I just want to probe a little bit. Do we share any information about our code of conduct or child safeguarding rules? For example, Gloria, do we do that? You were saying you wanted to produce some materials on this.
It's just year one. This year is when we are starting.
You will start doing that.
Yes, but what we've done, we've just issued a voluntary leave because the passage of the volunteers were not inducted in the child safeguarding. So we've just inducted them, and this week they are going to see the one-page short for
Right.
the Day4.
And in terms of budget information?
We haven't been sharing budgets to the community, except for one project that is funded by Oprah Winfrey. So the lady who's solicited funds is from a certain village. So she told that community the amount of money she wants. It was about $2 million. But this was the total cost for the project.
Yeah.
So we face challenges because of the community. We were told for $3 million, look at what we've done. And we contracted local people to build the school at all, and we were complaining so much that we were very little money yet. Oprah gave us $3 million.
But where is it?
Yes.
Yeah.
So I think that was really misguided way of sharing budgets.
Yeah.
But in other projects we have not shared the budgets. And I think for all of section 1, I've not seen this
that?
No.
Why not?
It's only in our con. It just has not been done. And no reason. Because I'm seeing a lot of things, some of the things that we've put in our framework for this year, like sharing information of vision, mission, and the like. We have one-page documents and project information which will be shared with our communities. But this is just the plan we have for the accountability for the assessments we did.
Yeah.
Nothing has been done.
I mean, are there examples where you've seen this done very well? Let's talk positive examples. Sorry, yeah, absolutely.
I was just wondering, when you're talking about sharing project budgets, I assume you're not saying share the entire project budget. So would you be suggesting that we just share the activities part of the budget?
Yeah, okay. Let's talk about that. Let's talk about that. The second how-to is on how to share information about budgets. Financial transparency. Yeah? So this is always a controversial issue. There's generally a lot of reluctance among our staff to share information due to a variety of kind of concerns and fears. I'll just give you the good practice guidelines. Yeah. So we recommend that the direct project costs for that community need to be shared. So when we say share project budgets, people say, oh, do we share the whole thing? Do we share our staff salaries? Do we share our organizational overheads? All the admin costs that go into running a program. The good practice guideline is that we at least share the project costs for that community. So saying, this is how much money is available for your village, for your community, for your town. Things like, what do the materials cost us? Where do we get the money? Things like that. And when we say, what do we contribute to your community, then it opens up the discussion about what do you have to contribute. So it challenges aid dependency in a way. It helps us at least challenge it, saying, this is what we bring. What can you bring to this project? And it doesn't, of course, have to be in terms of money, but we're asking their engagement, we're asking their time, sometimes we're asking for their labor, sometimes we're asking materials, all those things.
And sorry, I know this is nitpicky, but if you're doing local procurement in the area and you're putting the budget for what the materials cost, how would you mitigate the kind of questions that arise around that?
Yeah, okay, we'll get there. So if you turn to the second page of your how-to guide. Sam, you don't have it.
Yes, I do.
How-to doesn't have it. You have it? Oh, no. Okay. So we talk about some barriers here and some fears and how we can deal with some of those. And some of the issues that you've raised are there. For example, what if the community challenges what we are spending or doing? Saying, give us all of the money. Let us manage that. We will do a better job of managing that. Yeah? Or they will scrutinize it. They'll ask more questions about, well, you bought so expensive material. I could have helped buy it, for cheaper, or things like this. So, what can you do about this? I think we will probably need our help from our finance managers, probably, to come to program setup meetings and sit with us in the program setup meetings with the communities and be ready and help us answer such questions. We might need to explain our procurement procedures. We might need to explain how a large NGO our size works and that we have to get 3 quotes and this and that, and then decide and make a decision based on that. And of course, we have, explain things like we have to be sensitive to not doing harm to you know, the local producers. We have to be sensitive about where we get our materials and not fly things in and, you know, disrupt the market and things like that. We're not always good about that, but wherever we can, these are our principles and we need to be able to explain that. What if the community does not like or accept the donors? In many countries in the world, especially in conflict situations where, say, US has you know, a bad image or involvement, and we come in with USAID funded project, the community does not want to hear that this money is coming from the US government. If they know it, it affects our credibility with the community. And USAID sometimes, more often than not, are aware of this dilemma, and they are okay when they sign the agreement with us to say, okay, in your branding, do not put our logo. So it is possible to agree with the donor to hide or not explicitly put their logos into our, you know, distributions or our project, you know, branding. So, I mean, the principle is really we must always try to use our own reputation and track record to help build rapport with the communities. So what if there are low literacy levels within the community? Yeah, so you were talking about sharing budgetary information. You're not going to put, you know, long Excel sheets in there, complicated budgets. You need to summarize it by activity, by area, no more than 15 lines of information, present, of course, in local currency. So, you know, simplify. You can use charts or verbally or visually share information on this and try to make it easy for people. What if security issues mean that it's not advisable to share budget information? Yeah? So, what we're saying is that sharing budget information can be a sensitive issue. Therefore, it needs to be a team decision to do that or not. So the team, the project team, needs to sit together and decide what are some of the risks involved if we share this information, and how much information are we going to share, how much detail we are going to go into. So it's up to the discretion of the team, and then, you know, once that decision's made, certain tools can be developed to share this information. What if our internal culture and procedures make it difficult to share information? A lot of this resistance is actually internal. The risks that we think are out there might not be that great, or they might not be actually real. We might want to be in a position to actually be a bit more courageous and experiment and see what happens. And for this, we need, of course, support and encouragement from our program managers and our senior management. There are organizations in our sector like ActionAid that make it absolutely mandatory to share budget information, along with the other sorts of information that needs to be shared. Budget information is there. Of course, you know, when it's not secure enough to do so, I'm sure they don't do so. But in, you know, most country programs where all conditions allow for it, it's mandatory for their staff to share direct costs for a given community. And I think in some situations, more often than not, they also even share overhead costs and staff salaries. So some organizations do it. And we need to also be able to kind of push ourselves a little bit in this area. So finance department needs to work more closely with program department. In order for us to be able to be financially transparent, our own field staff need to know about the program budget and need to be able to explain the budget. In many cases I've seen that the program manager doesn't share that information with the field staff. They're operating, but they don't know some of the basic financial information. So there isn't that transparency within the organization. Sometimes, more often than not, there isn't that transparency between us and the partner. We hide our part of the budget, although they can't see possibly our, kind of salaries, overheads, and how much we are getting versus how much we are kind of giving them. And sometimes they don't have details of, the activities that they're supposed to be implementing. Is that your experience as well?
A positive experience.
Okay.
With the women's groups I mentioned that I work with in Bolivia, they were, well, I think it's relatively positive. I don't think the information regarding staff salaries was shared at all.
Yeah.
But the sort of things like materials and transport costs and things, there weren't actually that many materials, it was more of a capacity project. They were one member of each organisation was trained to be the treasurer of the women's group, and they were actually given a certain amount of money to administer themselves and taught how to sort of keep very basic financial records.
Yeah.
And it wasn't a large sum of money. But, for example, if they held a meeting or lunch for people, it was like quite small sums, or if they travelled to another community to meet with people. And in that sense, it was more like they were sharing the information back with, say, the children.
Yeah.
Because they were more in control of that particular part of the project.
Actually, in Kenya, do we share any financial information?
We don't share the salary, but when we usually have the project, we have the grant startup meeting with the communities, inviting all the stakeholders as well as the communities.
Yeah.
And then we share the detailed implementation plan.
Yeah.
Or when will the project last, or how many months or how many years, the target group and these things, but we don't share the salary. So.
But do you? I'm not asking about the salary.
Yeah.
Do you share direct costs for that community?
Yeah, we share.
Okay.
In terms of the target group, the target person, we share.
Okay.
As well as the recruitment. If we wanted to hire the project staffs from this community, you need the project staffs, but we specify the criteria to them so that if they are applying, they know the criteria. Yeah. And then when we are sometimes when we are doing even shortlisting and these things, we even inform them that we need some of the representatives so that they will be part of us when we are doing the interviews and these things.
Okay, sounds good. Yeah. How about in Afghanistan?
I have a positive example from Pakistan.
Right.
Silicon was implementing the project. It was education, livelihood, and environment project. And then two partners. So partners were sharing the budget the community was supposed to manage, like construction and then livelihood projects. So there was budget for communities to manage. And then that budget information was shared with community organizations because there was also community contribution 20% in that budget. So that information was shared and it was
Nice. Yeah. Okay. Well, there is a section here also about why should we, share information about our budgets. It increases ownership of the project. If community knows how much things cost, they are more likely to be involved and help us protect the project assets. Yeah. So if they know how much it costs us to repair the school or put the well into place or a particular type of machinery or a training or what have you, then they're likely to appreciate it a bit more. It challenges notions of dependency. Again, we're saying this is how much we're bringing to your community. What do you have to bring if this is our project? It promotes a culture of transparency. So if we share information regularly about our budget's expenditure, it will encourage citizens to exercise their right to ask other public institutions to Yeah. It promotes value for money. Publishing or sharing information should help us try to be more cost effective. Because we know we're going to share this information, it will help push our staff to be a bit more careful about, how much we're paying, where we're resourcing our staff, our materials, because we know we're going to share it, and it will push us to be more cost effective. And sometimes when we share this information, we might be able to actually get recommendation from the community, and they might be able to direct us to more cost-effective ways of running things. It helps to prevent fraud. If we know we're sharing budget information, again, we'll be more careful about our financial processes. It's a learning opportunity. Discussing project finances with the community will help us learn from the communities. We'll learn all sorts of things in this discussion. Yeah. So this is some of the guidance. We're not saying go all out and put it all out there and share everything down to your salaries, because the first thing that staff thinks about when we say share budget information, they think, oh my God, they'll share my salary. So if you get that sort of pushback when you talk about financial transparency, you can say, wait a minute, it's not really what we're talking about. We're talking about direct costs for that community. And the thing is, people have a right to this information. Imagine that we are part of a village, and this organization comes in and says, we're going to do a project in your community, but we are not sharing information about timelines, who are we as an organization, how much is the project going to cost, the objectives, and all this is in, it's in this list. I'd be frustrated. People have a right to this information. And unless the security issues prevent us from sharing this information, it's our duty to share this information. And we should be really always challenging ourselves to be more open and more transparent, and kind of take those steps further so that we can build closer relationship with the communities and hopefully establish a bit more trust between us and the communities. Otherwise, really, we look all the same with other organizations, especially in an emergency situation where there's zillions of organizations operating in an area and we all look the same to people. They can't really tell us apart. They don't really know what's going on. And it's really a shame, and it's a waste of, for us in terms of achieving our objectives. Anyway, enough lecturing from me. Any further thoughts?
I have a question about working in Pakistan and Central South Somalia. And I was just wondering whether you just basically don't share any information with the communities because you're kind of trying to work under the wire, as it were, so that people don't even know that you're there, or whether it's possible to share some information. For example, if we talk about financial information, you can show like graphs of percentages of the project activity budget that's spent on this thing or that thing. I was just wondering basically how much you feel like you can present information.
Okay, so I think a good example would be FSL program, as Marcy mentioned. What we do if we have some funding for X village, we will go to the community, we will do a broad-based meeting, we will sit with them, tell them that this is part of the project, this is what we want to do. And this money we have, how much you can contribute. I mean, maybe with your resources, with labor, with any other support that you can provide. And then we start implementing this project. As there was a example of Australia, someone from the community is responsible for all the financial things, record keeping. And then the community members also do monitoring and implementation in this kind. The only thing about this information checking that we don't say that we are from this. We say that we are from an organization helping and working for you. And we share all this information, but we limit it up to some extent so that because there are some administrative level, like we have mayor, we have the same sort of town nazim or something like this. who try to influence if we tell them that this money we have. So what they will do, so they will try to divert this money to their own constituents. So it's better that you go with community and you have already decided where you need to work and then you share all this information.
Okay.
So it's specific according to the context.
And you would only discuss it, you wouldn't display information.
Yesterday, if you remember, you see a board,
Yeah.
we share information, but we don't put any Save the Children logo. We say that this is very an organization working for our children and for you. But we don't. Even the staff, I think, one thing that is important to mention along with this document is that this information sharing is very sensitive. It can be very sensitive in areas like Pakistan or Afghanistan. Like if you are associated with Save the Children, it might be very dangerous. Even for the beneficiary community members. So.
Right.
I still have questions about saying we're from an organisation that's working in health. Do you think people actually know that it's for children? Anyway, in my experience, which isn't necessarily children, but in a similar context, they know.
Can I say about this?
Isn't it without kind of?
Like in Pakistan nowadays,
Yeah.
normally when the airports, they ask that where are you working? When we say Save the Children, they say, no, Save the Children.
What does that mean?
Quite famous.
Yeah, because they think it's
in Pakistan, negative. It's obvious.
especially the vulnerable people.
Yeah.
Because there's a tension between the government of Pakistan and Save the Children on that Accountability issue. Government is saying that Save the Children is 100% involved in that thing, tracking and everything.
Not
In what thing?
all the media is.
All the media, all the intelligence agencies are saying the person who was caught, he is saying that Save the Children helped me in that thing.
The polio vaccine.
Osama bin Laden. You know about this, yeah? So in Pakistan, there's this allegation that Save the Children was involved in helping the US government capture Osama bin Laden, yeah? So,
The CIA agent.
so you're like, oh, Save the Children, oh.
I
we
thought
pay
it was
them
like-
work for us.
I thought what it was they was that the CIA did a false vaccination campaign to try and
Yeah.
get some information. And then the NGOs were also doing real vaccination.
Even in my
No, but he said that he was trained for Save the Children.
This person was
Well, he didn't get to the
sporting
same
CIA. But
But
he
that's
was doing
the
that.
He questioned me. You are working for Save the Children. So no, my father.
I've been wrong, I was right. Wow.
What's up?
So then I explained the whole thing to my accountable because I'm accountable to my father as well. I explained the activities of Save the Children and everything. We are not spying. We are doing the work for children and this and that.
Okay.
So I mean, there are communities where we can say about our budgets, our activities, and there are communities where we cannot explain the things. We explain a little, but not explain the whole thing because in this northwestern part, there is an issue of missing person. Like if anyone know that Assam has some millions, then day after tomorrow he will be a missing person.
You have some millions. You're out.
No, it is enough for, there are some parts which are neighboring Afghanistan and he's from that part. So if you claim, if somebody comes to know that this person is working for Save the Children, then your life is in danger. Without any doubt. Even a girl if that is associated with these are NGO workers, there are so many things with NGO workers. So there are other parts which are a bit peaceful. There we tell them that we have Save the Children, we have to go everything. But the parts neighboring Afghanistan is very. So we even, if I will go, I will not say that I work for Save the Children. I'm just a ordinary person like
What do you say?
I say I work for people, and unless someone is really very then I might share, but otherwise I can't share. Then I would say this is one.
Yeah. Catherine, last
I have an interesting example which is kind of ongoing. So, World Vision is doing a project that's in Taliban-controlled areas of Afghanistan. And it's funded by the US Department of Agriculture. It's a weird one, it's food vegetation. So the team at the moment want to put out a brochure encouraging school enrollment. So I was talking to them and they were saying, we're not going to put the World Vision logo because there's this idea that they're spreading Christianity in Afghanistan. So we're going to put the USDA logo. And so I was talking to them and I was saying that, most people are only going to seize on the US part of that logo.
Yeah.
And that's going to cause problems for you. So they were like, okay, well what we'll do is we won't put any logo. We'll say we're an organisation that's working with children supporting education. But then the problem with that comes up is that's kind of an unforeseen, an unknown threat. So they were saying, the leaders in the areas were saying, well, who is this organisation?
Yeah.
Why are they doing this? And education is actually kind of controversial in that area anyway. So they've come full circle. They've decided that they're going to put the World Vision logo on and then have a very clear explanation of their vision with no kind of religious affiliation, that kind of thing. So it's kind of this really interesting process that obviously it wasn't right to include the USDA logo, but they also couldn't put we are a children's organisation.
No, all these decisions have to be made, I think. Sometimes only the security people are pushed to make these decisions, but that's not right. I think the security and the program people need to sit together and discuss these issues together in all the different aspects, while consulting partners and the local people who will have a judgment on how we might be perceived. It makes a huge difference, isn't it? That's great. I just show you, I have a ton of examples, but it'll take time to go through them. I've put them out there for you to look through throughout the day. We haven't talked really about child-friendly information sharing, so there are some good examples of that largely I've got from Myanmar and Sierra Leone. This is a child-friendly document on the annual plan for Myanmar. And they've produced this because they've actually done consultations with children on their annual plan. So, in education, this is the areas that we want to work with. So they discussed together, they discussed priorities, they brought in the children's inputs, and they're working with like a national, is it a task force? They're all called different things. But basically, in the various villages where we work, children select representatives at provincial level, and then those representatives are brought together representing their communities to discuss their priority issues in the thematic areas where we work. So they produced this at the end of that process. This book belongs to. It gives some information about our organization, our values, and then child safeguarding policy. This book will let you know about X, Y, Z. These are the areas where we work. These are the different thematic areas. And then child protection will do this and that. And when they produced it and they took it back to the children, they said, it looks nice, it's all cartoons and stuff, but it's all NGO speak inside, So they have to work further on the language.
There was also a comment from the children they showed it to that the ethnic groups within countries weren't all represented on the front.
I see, on the cartoon, I didn't remember that. That's nice. This is very nice. I like very much. This is the Save the Children's profile for children, again from Myanmar. And it tells the story of the organization. Yeah? So there was World War I. There was Eglinton Jeb. We work into 120 countries. We started working in Myanmar in this year. We do education, we do health. It's much simpler. and it's much easier to use this tool to tell a story of the organization. So that's a success, really. Sierra Leone took this and they made their own kind of version of it. Yeah. So,
Is it in the local language? Like, is it in the dialect?
let's see. This is in English, but I think they have it in the local language. Yeah. Yeah. So what I shared, I forgot to talk about this. This is an information sharing template. Yeah. And it mirrors the information sharing how-to guide. So one thing we've been struggling with in the breakthrough countries is how do we systematize information sharing? How do we make sure there's a certain standard to it and X, Y, Z we know gets shared in every project and ideally on a regular basis? How do we systematize this? How do we monitor it? How do we ensure it's happening? It's very challenging. And one thing that we came up with, or some countries came up with, is these templates. For each project, to fill in this template, yeah, and each program staff to have a copy of it. For people to be able to share information, they need to be comfortable speaking about the information, yeah? And it's not always easy. I mean, when you're in the community, you might be a new member of staff, you may not know about the policies and just speak about them like this. You know, there's so many things in here. You may not be able to recite all the project objectives in your head. For staff to have a copy of this and to use it and to become comfortable using it. It's important that it's in the local language for our staff and partners, of course. And the contents of it, again, can be decided by the program team and it can be disseminated. It's enough if one person fills this in and it's disseminated. And people, we ask, the program manager asks, please familiarize yourself with this. Make sure you are comfortable about explaining these things. The basic information about our organization, the project, how people can be involved. Yeah? In China, they are using it with government partners. Of course, in China, we work with government. The partner is the government, yeah? And all of the programs come together and they agreed on kind of a unified way in which they are going to present the organization. That's nice. I really like that. And where else? A couple of countries are also really sticking to this approach with the templates. Yeah. So see if you can use it. And also, the other nice thing about this is you can actually leave this with a community committee or with a community member. So they have it when we're not there. They can be the person to go to share this information. Copies of this can be stuck up on the information board. Yeah? Sometimes it's too much text. You know, whatever we stuck on the information board needs to be a bit simpler. But it's a starting point. It's better than not having it there. I think. All right, enough? Hassan. Yeah.
Regarding this, in the part 2, the second last year's progress report.
Yes?
What is the progress this one? And what is the
For next. Yeah.
Like the frequency, like monthly sharing with the community for the last
Might be difficult.
Yeah.
Absolutely. I mean, this is not set in stone. This is good practice guidance. You take this, you sit down with your team and decide what can you share, what can you push yourself to share. You can experiment, but you know, put quarterly progress report, however often you can meet, put that. I mean, it's not set in stone. Any other thoughts? Shall we hear from Hassan? Do you want to connect your?
Yeah,
You don't have a memory, okay?
No, actually, I have opened websites for references. that how technology can be used for information sharing. There are some agencies which are using latest technology to share information with the beneficiary. Any ideas? I mean, any one of you can share something for information sharing, like we have seen these templates. Keeping in mind the technology or the mobile phone or the mediums that we have. What do you think? What can be the fastest medium or how we can share information with our beneficiary detail? Maybe you can think of urban setting or maybe some developed countries. Text messaging, please. Anyone else? Radio, yes.
Text messaging, what was the second thing?
Text messaging, radio too.
Radio, yeah.
Okay.
Yeah.
Okay, let me show you something, then I will explain it. So, as my colleague mentioned about the text messages, there is another thing which we call SMS services. We have seen like promotion companies, they send us text messages which we receive, and they are doing some sort of promotion thing. But the new approach with the use of this technology is that we can use text or the bulk SMS to reach our targeted beneficiaries. One example could be like we have a number of or set of contact numbers for our targeted beneficiaries. Using some software, we can send them bulk SMS for maybe for our new some sort of services, code, or anything which we want to share with them. Another example could be like for health. If we know that we are covering this particular area, then we can send some of the preventive health messages to bulk SMS. I mean, there are maybe 20,000 people, or maybe 10,000 people, or 5,000. A bulk SMS can reach all those within few hours. So this is something, and then I will give you the example that which organizations are using this and how they are. This can be another mean. Okay, this is another thing. Yesterday we discussed about the CRM. We thought that hotline could be a best way to because most even in the Somali or even the remote part of the world, people have access now to mobile services. So this is something like FAO in Nairobi, I think. FAO working in Somalia, they have established a helpline like a call center that is based in Geneva. Maybe I'm not correct with their location, but they have a central hotline or helpline number where people are sitting. If you are a beneficiary, you have a number, you can call them, they will give you information, or you can ask them for any information. So this is something that is in practice. Or you can call a dial-free number to get some information about Save the Children, maybe, or whatever. Let's come to Twitter and Facebook. Normally it is used for networking, social media, something like that. But if I'm not wrong, even Save the Children has some account on Facebook. There was some campaigns which were launched on Facebook site, and then we investigated it. So, a lot of organizations are using Twitter and Facebook for information sharing, as well as somebody has to say something about the organization. So this is another important medium. These are very maybe unfamiliar kind of words for you, like sharing and frontline. Basically what these are two softwares which are very easy to download if you can install them on your system. Let me explain a little bit on these softwares. What they do, like Ushidi or the frontline SMS, the service provider will have a contract with you and they will provide you a set of services. Like if you have established a CRM with these two softwares, each SMS, feedback, voice, anything that will go to a system, it will be automatically recorded, that will be automatically uploaded to their website, that will be automatically went to the further analysis, uploading. I mean, it's a very unique system or innovative system, like somebody has called from Somalia, and then you can see on the website that this complaint has been launched, what is the status, where it is, has it been processed or not. And then that information is populated on Twitter and Facebook accounts automatically. So this is a series of services automatically linked and very fast in a way that if you are a donor, you are having a project with Save the Children, you can just log on to their website or just go to their Facebook or Twitter account, and then you can see like how many complaints have been launched, how many have been processed, what kind of complaint, and there are different filters of what the complaint. And same is the case with information sharing. You can also share information with your beneficiary. I will give you an example, like if you want to do a survey, like you have 4 or 5 questions, or maybe 1 question with 4 options, you can send it to your target beneficiary and they will reply back. It will be automatically stored, analyzed, information will be generated, everything will get. Maybe a good example, if someone of you has used the PDS, it automatically does the same thing, but more at once. Radio messages. Radio can be a very good means of spreading information for community awareness, but it is good where we have to do a blanket coverage sort of thing, like a population, which is solely, which is entire population is our beneficiary. But if we are only targeting a group of population, then radio might not be the best choice because it might overburden our staff, might spread the information to the people who are not our targeted people. But these days, FM radio channels are very popular around the world. People are using this for sharing the health messages or any messages which are related to them.
How would the radio overburden our staff?
Sorry?
How would the radio messaging overburden our staff?
Okay, like I'm working in CTX and I have health program which covers only 10% of the population. And I'm saying or I'm providing the information about the program. And the people who are listening, they are not very well aware that it is not in their program, it is not in their area. So they might be questioning or they might be, trying to overburden, or maybe some people trying to use the facility which is not meant for them. So that might overburden us.
Okay. So
It's a good thing where we have a total or blanket coverage.
yeah. And also it's a good thing when you're sharing, say, life-saving information or protection information that applies to everybody, regardless of whether they're benefiting from our particular program or not, So it's for really information sharing, not about the project, but information about the particular service area.
Or preventative.
Preventative, yeah.
Maybe education messages.
That's
or
it, yeah.
something.
Yeah.
There are so many things which we can do with this.
Can I just ask you
Yeah,
a
please.
question? So, about the youth sharing frontline, I was interested what you were saying about how you can use it to collect information from beneficiaries. So you can maybe ask them 4 questions and then ask them to text back a number to
Yeah.
give a response. But does that, when they text back, does that cost them money?
Yeah, this is what I mean. This is something where we are dependent on the technology. Normally, if they are in UK, they will give you. All costs will be covered by these providers. Even for the Kenya, when you talk to this frontline SMS team or maybe they will negotiate with you on all these things. Then what do you want? Do you want your beneficiaries to pay the cost, or are you going to pay for it?
So you can do it.
So you can, and again, that is dependent on these type of services available in that area. In UK, you will have everything, but in Kenya, maybe the mobile network, they do not support. But mostly, they have this feature. Okay. So distribution of mobile phone radio. We were talking about in Fawcett project in which we distributed radios, but I know some of the organizations, they are now distributing mobile phones. I forgot something, but I was reading somewhere that an organization is working to give mobile phone with the 10 days battery time to beneficiaries, just to improve their communication and just to share information. Their only purpose to distribute these mobile phone is that these people are connected with each other. Their sole focus is to improve the communication and the quality. There are some organizations which are working on communication, but this can be linked to our information sharing and maybe some sort of print response mechanism, because it will not cost a lot to give a household a mobile phone when you are giving them maybe $200 for a certain project. So it's good to give them a mobile phone as well, so that you can contact them throughout your project cycle. So it can be an idea, or it can be used. Okay, then print and electronic media. Again, this is very context specific. You can use newspaper, you can use TV channels, you can use maybe some other advertisement to reach beneficiaries, to share your information with them. Like in some areas, print media is the best media to share about any kind of campaign you are going to start, any kind of project you want to start. This can also be some other areas. So what I'm going to do is to show you some practical examples.
Can I add one thing?
Yeah, okay.
It's very good. In one of our projects, which is implemented in 4 districts. 2 districts are insecure and inaccessible. You cannot go there. So what we are planning to do is distribute cameras with memory card. And then we are planning to train some people in the community taking pictures of our activities. It is GIS enabled camera.
What enabled?
GIS.
Right.
Yeah. And they will take pictures of our activities, like if there's any livelihood activity or construction of school or like anything, pathway. So any activity, they will take pictures and then they will send that memory card to any medium, like local driver or any person to the office. So we will receive those pictures to see what's going on in the field, in that remote district.
Thank you.
Interesting. This is very new. You haven't tried it before.
Yeah, we are piloting in one project now. We have purchased the cameras now.
How many?
We have purchased the cameras.
How many cameras?
There are 10
How many
cameras.
people in the community get this, and who do you choose the people?
Yeah, like the selection process is that I have asked the staff to select, make a group in a village composed of teaching staff, health staff, children from schools, out of school,
Right.
and then train them to how to take pictures, why we are taking these pictures, what we are doing here in the community.
Interesting.
Yeah, and then because they cannot send the camera because in the way they are Taliban, so they can send the camera, but the memory card is a small thing, and they can send to the office.
What if you get their personal pictures? What if there's some personal pictures in Africa?
Me and my uncle.
Yes,
My
sorry.
birthday cake.
And if you are taking memory card, what they will do with the camera?
So camera is with them. We will copy the pictures and then we will send the memory card back.
Back.
Yep.
Very interesting. Let's see if you could keep us in the loop.
Yeah.
Interesting.
Okay, this is a comparison. I mean, what I told you was some of the practices by different organizations, but this is real. I mean, what DRC is doing, and the rest is the Somali NGO what they are doing. So DRC, they have a very good system which I explained. They are using Ushedi software, and in a while I will.
Danish Refugee Council.
Yes, Danish Refugee Council. Sorry, it also stands for Dominican Republic of Congo. So what they have done, they have CRM. Their CRM is based on SMS system. Like somebody from anywhere, they can send SMS. It will be automatically stored in the system, uploaded, everything. You will see now on their website how they are presenting. There are plus and minus of the system. In the red, you see there are some drawbacks with each system. Like they are relying on all the SMS, and we know that people they don't like to complain through SMS. So many people they have tried, and then they have to send, and there is hardly any response. They know that they are not talking to anyone, and they are just sending. So I have done some analysis. They had this system for almost 2 years, and up till now they have received only 316 feedback or complaints, which I will show it here. So this is very low, maybe 15 or 20 per month. This is something which they need to improve, or somebody who is working on it. And also they are also using it. They have done a very good thing by installing by taking a phone line in which they have automatic voice messaging and these kind of facilities. So calling, they know that somebody will speak in Somali, and they will say that you can drop your message or something that is a toll free. So it's good that people can call them and they can record their voice messages or something like this. But their system is not very high tech as compared to DRC. Their system is more manual, and that is more linked to the project. Like they have, what they have done, they have made a database of their FSL beneficiary and link it with the contact number. So if somebody is calling from the field, system will automatically pick the number and that will tell that this is beneficiary this, it has all these details, because their primary identity key will be the contact number. So it's project specific and it's working. So if you have any question, so you can ask, or I will show you the DRC site and then we can discuss more.
I have one thing
Yeah.
to addition to that. If we go to the extranet of Sitachilam, I have seen there one link of fraud complaint. In the SCI extranet, there is one thing, fraud complaint, like there is something where we can complain about frauds in SCI extranet.
That is
They
for
have
our
started.
staff.
They have started.
This is for our staff. Extranet usually sells for if you are a SCA staff.
Yeah.
It is not for beneficiaries.
Yeah, it's like a whistleblowing
Yeah.
mechanism that's
Yes.
there.
So in neither of these systems, everybody gets a response?
Yes. For the DRC,
Yeah.
they are very open. I mean, their good thing is their system, maybe if you see in terms of beneficiary satisfaction, it might not be as good or effective, but in terms of presenting to donors or to any other, that is very good. I will show you their website. And you, what you are saying about the response, yes, both of these, they respond to their beneficiary.
Okay, so for both of them, if I call up, I'll definitely get a response as well as a bid.
Adesso is it also used by the RC or?
Adesso is a different organization.
I don't know them at all.
Yeah, that is Somali-based organization. Say that they are international.
Somali-based organization.
Yes.
Quick
Yeah, it
question.
is formerly Home Relief. Adesso is formerly Home Relief because they came to African Government Solution. It is formerly called Home Relief.
Is this for their entire country program, or is it
It's
for a project?
Adesso basically their program is specific FSL project.
Okay.
Mainly it is focusing FSL project, but for DRC it's for their all programs.
So do they, I mean, maybe you're just
Yeah.
about to show this, but do they ask in the hotline that the beneficiary has to identify the project, and isn't that a problem?
No. They are just open, and what they do, they try to identify the area by the location from where complaint is coming. What Nasir was saying, and what you are saying, it has a mix of both. I will show you the next slide.
Can I also ask, I'm so sorry.
Please.
So it's not SMS based, it's voicemail based. When I call, I speak my complaint. And then what is that sample of beneficiaries? They don't follow up with everyone or just?
For Adesso you are saying this.
Ah.
Okay, let me explain. We had a discussion with DRC with Adesso as well. DRC in their presentation, in their material, they call it SMS system. Normally they don't call beneficiaries unless they receive something and then they have to further investigate. That is why their response is low. Only 316 responses they do. For Adesso, they have FSL project in which there is chance that beneficiary can call their hotline, but if not, they always, when they do distribution, they randomly pick maybe 40, 50 beneficiary and they call them. As a PDM sort of thing, or maybe just to know the transparency or something.
Adesso calls them.
Yes, Adesso has dual system, like incoming calls.
Calls and outcome.
Yes, outcoming calls, only when they do distribution.
Right.
To generate a report on all the distribution.
It's quite impressive that they're actively soliciting, not necessarily through PDM, but actively sort of asking for feedback on
Absolutely.
what's happening. You know, not just for the like M&E.
Yeah, like when we do
actually to find out-
post-distribution surveys, it's just one form of doing it over the phone, I
Yeah.
guess, isn't it? Yeah.
Yeah, I mean, it's, I it'd be interesting to see if they're getting like a wider understanding of how those.
When you say project database is linked to the CRM database, what do you mean by that?
This is what I said, like they have a big FSL project, they are in a consortium with CFHA. And what they have done, when they do assessment and beneficiaries, they take a mobile or contact number of beneficiary and then they store in a database. So somebody who calls them, it automatically picks their number. But this is only for FSL project.
Oh, I see. So it matches IDs.
It matches IDs.
Okay.
And that is, and they made this CRM only for that particular project. I mean, it covers their overall system, but mainly it was for FSL project. And what you said, I'm a big fan of this hotline system that we should not limit it only to receive the call because beneficiaries, they don't have money, they have problem, they don't know the system, it's hard for us to reach them. And then the staff who is over there might be also responsible for complaint handling, so we are not comfortable with them. So it's better that you also approach them through this outbound call or the outgoing call to track them. And this is what we are doing in Somalia today. And we are facing very challenges within our team and with the community. Which is, we have started. What sort of challenges, like people, like the information that we are getting, it is contradictory to what information field is giving. So then you see that there is a difference, so we have to see that how we can work it out. And yes, one more thing I would like to specifically mention, like the people who are doing FSL, who are doing NFI distribution shelter, in which there is any kind of cache involved or any kind of distribution is involved, this system is very good to do as a part of PDM, to know what has happened, what was the process, have you received everything. It is like, it can be like alert or whistleblowing something to tell you what has been going in the field. Because Bradesco started this system and they are very careful about it because they came to know that there were 3 or 4 villages which never existed and they had done distribution for almost 2 years.
Right.
This
Do you have a picture of their visibility posters?
I do, but I don't have it with me right now.
Can you send them to me?
I will.
Yeah.
I'm trying to find soft copy. I have a hard copy.
Yeah.
So what I was telling, let's see the practical, what they have done.
Yeah.
So this is DRC website for Somalia. I hope everyone can see this. They are explaining the SMS feedback system in your beneficiary to have a direct access to DRC and voice in the decision-making process. To allocate funds to local project, tasks of DRC, better monitor the effects of the project on this. So what you can see is this map, the GIS. When the complaint is launched, it comes definitely with some area. And this Ushedi software, it gives GIS coordinates, it goes up to automatically to the location. So it is visible, like there are the categories on the right side, and on the left side you can see visually from where complaints are coming from each area.
Yeah. Nice.
And then if you
I
go,
want this.
that is what I said.
I want to see like all the countries where we work, like it's in at least the breakthrough countries. Wouldn't that be great? Yeah, anyway, continue.
Okay, so it says, if you say November 2011 to February 2013, this is what I was telling, that they have started it in November 2011 up to now. This is telling this whole story, and it is live, it is automatically gets updated. So they started in December 2011, the graph shows how it went up and then it went down, because in April 2011 there might be, it was peak of emergency, something like this, and then it went down. You can see at February where it is, so it is getting very low.
Yeah, that's great.
Yeah.
Okay. Well, you have a hotline in Somalia. Can you tell us about that?
Yes. Is everyone fine with this? Because now they have different categories, labels, geographical areas, something. These are some of the complaints. And if you will click on their complaints, you can go through complaints as well. They hide the identification of beneficiaries, something, they apply the filter. So you can directly go and see, and
You can actually read the complaint?
yes,
Can you see the ID of the complainant?
yes. No, you can
That's
for
not
some.
right. That's not right.
Sorry?
Can you click on
If you connect to internet, definitely.
Oh, I see. Okay.
So,
Well, I mean, we can go onto the website on our own time.
yes, you can go to their website, but I want to tell you that this system is very good in presenting to donors to show transparency because it is online.
Yeah.
And secondly, what they have done, this system, I mean the complaints are coming, there is another link which shows that this is pending processing. So after a certain period of time, it becomes like a red or alert sort of thing that this complaint has not been processed.
Right.
There's something that needs to be done. So the senior management of people will go around. And secondly, it is controlled. It's not like they are very 100% transparent. They control some complaints.
Yeah,
They
okay.
manage.
Well, this is, I mean, transparency is one of the principles of a good, effective CRM, yeah? And we generally look at it with the perspective of the community. So that if the community member comes and wants to have access to our database, our files, especially to see when did I put in my complaint and what's been done with it, what's the status of it, we should be able to kind of open it up and kind of share it with them. So in that sense, this is a nice example. Not necessarily for the community member, you know, they won't have internet. This is more for the donors, the peers,
For the public, for the media.
yeah, for the public.
They are taking directly complaints from here to their Twitter and their Facebook. And on the Facebook and Twitter, they have their donors, they feed, everyone is watching
Yeah,
what
so
they
they're
are.
talking
They
about
are
that.
impressed. I mean, wherever they go, they say that this is impressive. Though we know that SMS is not the right medium which they have selected. Everyone knows that it's not. But what they are doing, this is
Why do you say that SMS is not the right medium?
because in the community, if you go, they prefer to speak.
Right.
If you talk to them, they like to speak and they want
And
some
explain.
response from the other side. And that is validated through this number of feedback complaints. If you see 2011 to 2013, 2 years and 316 responses, do you think with all this system, I think they might have maybe 1,000 if they have given some access to voice or made some emphasis on this.
Yeah.
This is my personal opinion.
Okay.
On this. So any question on this or any clarification which is required?
I want to hear about the Somalia thing, where you have both incoming and outgoing.
Okay. For Somalia right now, we are in the process of finalizing our strategy by the SMT. So we have so many inputs coming from different people. So what we reviewed in our accountability assessment, we realized that we have system of CRM at field level, but due to we don't have direct access to Somalia, and there are so many other factors which are contributing, we are not getting the desired results. One thing is that the staff, like FSL team, who is running this or managing this complaint response mechanism, they are also the implementer. So the complaints that were coming were like, my token has been lost, my name is not correct, or something like this. And we really wanted to know the issues of community, what was happening in the field. So what we did was like, we had a FSL project, and what we did, we tried to have a same sort of system at Nairobi level, along with strengthening of the field level system. So first we communicated to field that this time we will be also supporting you, but these are the steps for information sharing. So you can do information sharing with our beneficiaries. We made some pamphlets, we distributed the token. So every beneficiary received a pamphlet which was saying this is Save the Children and you have these rights. And if you have any problem, you can give your complaints to field at this number. And then second thing was, Save the Children might contact you to know your feedback or complaints to improve the program. We made them aware that they might receive a call from Save the Children. So when distribution ended, we checked with our field team and there wasn't many complaints or feedbacks. So we did some random samples and picked around 100 beneficiaries and we called them. And we questioned them around different areas like what information was shared, what was the process, were they satisfied with it or not, or are they familiar with CLM or not. So the information they provided was quite alarming, like nobody knew that how they have been selected. They were receiving FSL or something, but they don't know why they have been
Criteria.
selected. They were not aware of the criteria. And then there were some implementation issues, like we thought that this is the best way to give them vouchers in the morning, and during the day they can collect their food commodities or something like this. But the beneficiaries shared that it was not easy for us because we have to make long queues, and then we have to spend the whole day in this thing. We had to do other plenty of things. So the information was coming from them was like eye-opening for us that this is what we do not know from Arabic, or this is what we never came to know from the field. So then we thought to continue it. Then there were some other complaints which might be related to transparency, or maybe like around 16% of beneficiaries share that the vendors that you have selected, that you provide good quality food. So we also took that how we should move forward so that we ensure that every beneficiary receives good quality food. So these were the lessons that we have documented these, and then we collected this into other areas, and especially to the areas where we don't have access. And as I explained, that it is very challenging because now the findings are coming, and the people who are in the field and the people in the Nairobi, we are trying to sort of that how we can work together to resolve the issue. One thing I would like to say about this accountability thing, that it is sort of monitoring, in my opinion. You involve the community in the monitoring process. I will give you an example, like in Pakistan, we had a health facility which was 4 hours drive from our office, and we deputed some doctors over there, but what they were doing, they used to come only for 1 day or 2 days, and we don't have any other means to check them. If we reach there, by the time they will be there. They know that the car is coming, and they will just move. So we did this accountability thing, and then we posted banners and aware the community that if there is any problem, we can. And that resulted like doctor reached to the facility at 9, and if they are not there, community will inform us. Same is the case with FSL. We have so many examples where community is now involved in monitoring. They hold us accountable. They also monitor what we are. Like for FSL, we were making a water channel, and they provided us some technical inputs that this can be further better because they were living in that area. There are so many other things. The bottom line is accountability is directly linked to monitoring, or monitoring is accountability. And then if we get a chance, I will be very much happy if we, as I said this evening, if we try to use all these things because we have so many problems. Like we try to solve this thing. But Secretary of Somalia, they don't have any website, and I came to know that for the website, they need approval from UK, and for UK, if you have a website, whatever the content will be on the website, it should be approved from UK. So these are the challenges which we have. And then again, there are IT policy and some other things. But I think this is our future. We should be looking at this. We have so many things, like which we said that we have database, we have one database which will be used in at least 6 countries. We can have more than this.
Yeah.
And then we can do certain analysis.
If maybe the accountability team were to pull through and host something like this, and the different countries could kind of have their own pages on it,
Yeah.
where
Global
stuff
site,
like that is uploaded. SCI should be doing it. It should not be based in UK, because SCI is the implementer. They are operational. So SCI should host something like that. I think we can support it.
Yeah.
Maybe initially, it might have to support it technically and financially, and maybe even the managing of it could be from us, because they don't necessarily have accountability advisors in SCI. They have a small quality team. They have a couple of people looking at, M&E issues and stuff, but they don't have accountability people. But that's a great idea. I think it's something that we can raise with them and see how it goes. But this is, of course, depending on, again, mobile technology, which is like spreading like anything right now.
Yeah.
It is really spreading. I mean, there's so many countries. Like we've tried it in Kenya as well with the Equals 8 project. That's something that we might, we don't have time to listen to Haji on it right now, but we also used Frontline SMS there And I don't have the data on it. I don't know, the numbers that came in and how effective it was and who was analyzing. My one question is, when you did the outbound calls,
Yes.
how long is it per beneficiary? How long does it take? How many staff you had to spare time doing this? And what was the analysis process like? Very quickly though.
Okay. First thing is like we have a number of challenges, like the technical thing, and if I don't speak Somali, but if we have to have Somali, then we need to change the organogram, which is another problem. What we did, we hired a person for a few days. So initially we had a problem in connecting to that. It took around 10 to 15 minutes for each beneficiary, because there were a set of questions which we were asking to them. So it was around 10 to 15, and in a day we used to get feedback from 30 to 40 beneficiaries in 8 hours.
Right.
And cost is not much if you see like 2,000 or 3,000 or 5, maximum is 5,000 USD. You can sample maybe 100 or 200 beneficiaries. You can take their feedback completely.
How much money is it?
5,000 USD. It's the maximum.
5,000 USD to talk to 100 beneficiaries.
At
That's a lot
least.
of money.
It's a lot of money, but it will cover your airtime charges, the person who is involved, or all the costs covered. It's a lot. It is the maximum. Maybe
You had to hire staff to do this, additional staff.
because we don't have staff. I'm telling you my experience. If you have a staff, then it will be only the airtime. I mean, I'm calling from Nairobi to Somalia. I'm talking about Nairobi to Somalia. But if you are in the same country, it will not be more than 1,000 USD. It will be very, very less.
Okay, and this is a one-off sampling, this isn't throughout the project duration.
No, as I mentioned, like this was when we did this. There were two components of food assessment program. One was food voucher, and second was cash over. When we finished food vouchers, we knew that all beneficiaries have received their commodities. Then we made this call. There were 3,500 beneficiaries, and we took around 100 beneficiaries as a sample from different areas. And then we did this. There are two things which I would like to say again. One thing is this Ushiri website. You can go there. There are plenty of things. You can see how their organization are using. If you are writing a proposal, if you want to do something in the future, do consider all these things which plan CLS and other organization has done with Shady or with the frontline. And this frontline is also very popular. This is what they have done. If you see, there is a very good story. And this one is also very good about the reproductive health, and then this one. With Plan International. So there are plenty of material you can go through that how you can adjust this to your and it will not cost you a lot. The last thing where I want to finish is that whatever we have discussed or whatever we will take back to our countries, there is one thing. One thing is accountability to beneficiaries, which is important, and second thing is its presentation. I showed you DRC, their presentation. Their presentation is good, so it means like DRC is doing I don't know how much in accountability. And as a Save the Children, I know that for Pakistan program in 2012, we received around 6,000 complaints. We have analysis, we have categories of complaints, we know what the problem, we have reports, everything. But somehow we were not that much strong to present it to the external world. So I think what we do as a Save the Children, we should also strengthen our this component of presenting accountability.
Thank you very much. That was super much more interesting than mine. But I want to share with you a couple of things before we end the information sharing bit. Using technology to seek feedback, to share information, to seek feedback, to complement our monitoring activities, to seek feedback on beneficiary satisfaction is great. There's one, the example from South Sudan, and one from Pakistan. It's a field monitoring report. So they actually went out and talked it says the objectives of the visit: to observe activities and utilization of supplies for an education project. They are establishing and equipping community-based classrooms. And the second objective is to collect feedback from community and children. Yeah? And then they've got direct observation, discussion with facilitator, and then debriefs with community members, children, and education coordinator. They put their general observations, and then there's key findings, and then in the debrief session, they've got the basically notes from what they heard from the communities. This is all about their satisfaction. So this is about accountability too. How we integrate accountability into our program implementation is by seeking the views of the community members on our progress, on our impact, on their satisfaction of our program. In South Sudan, Benson developed, for what project is this? Parent Teachers Association members' feedback. This is he produced, basically working with his team, a series of beneficiary satisfaction questionnaire. And this is a small report of that questionnaire. What has been the most positive thing about our support? Have you noticed any changes as a result of our support? What have been the worst thing you have witnessed about our project? What do you suggest we do differently to improve our services? What information have you received? What's going well and not going well? What is, so questions like that. And it's a series of 6 questions that they administer with different groups, with children, with adults, what have you. And the nice thing about it is, if you're able to do this on a regular basis, every 2 months, quarterly, if you can do it every month, great. Just go back and keep asking the same questions. You get a ton of information that you can act on to improve your program. It's very powerful. It can be very powerful. So I just wanted to share that. We've been talking about Frontline SMS, Info as Aid. Info as Aid is an organization that turned into a project of CDAC. CDAC is an organization. It's basically communicating with disaster-affected communities. It's a network. We're members of it. They bring together media organizations and NGOs. It's a nice combination. And projects like InfoSA come out. Media professionals who know about communications, who know about delivering messages through radio, through various means. And they also bring now increasingly, phone companies, what have you, not just, newspapers and radio people, but, private sector who are in the communications sector. And try to look at, especially their focus has been so far communication and emergencies. One of the products of their work is an e-learning course that they developed. I will send you the link to it. It's a nice 2-hour learning module that you can click through. It's quite colorful. It's in an emergency setting, an earthquake happens, and you're a program manager, or you're this or you're that. You're getting these messages you have to act on and make decisions about how to share information most effectively, what mediums to use, what sort of things to consider, risks and effectiveness and things like that. I've done half of it. It's quite nice. A phone rings, donor calls you and asks information about this. A peer organization calls and asks you, oh, you've got this information, can we cooperate, or something like that. Or your program manager rings and asks for something else. So you're really in the emergency, it's like a simulation. It's quite effective. So I'll send you that for you to look at.
Regarding emergency and FSL project,
Why are you speaking?
one project.
Oh, yeah. Yeah, go ahead, sorry.
As Hassan shared, normally we see that people having long queues waiting for their turn. I was monitoring a project of emergency distribution, and then I saw a long queue.
Right.
And people were waiting for their turn, and I asked the program person that why it's so long queue, why you cannot entertain the person quickly. And he said that we have a beneficiary registration form. And when I saw the beneficiary registration form, it was about 8-9 pages form. I asked the person, the program manager, how much time it take to fill one form. He said 45 minutes. Okay, why we are collecting this information? For what purpose? Yeah, maybe we will use it. Okay, so now what's the purpose of this information? Like 8-9 pages of information per beneficiary we are collecting. Who will use it? How we will use it? So then I asked that how many indicators we have for this project, like for donor. When I saw it was only 2 indicators. So, if we want to minimize that time and avoid those long queues, so it's better to have like small page with limited information that is required. So normally when we design questionnaires and for research sheets, that's the mistake of the program people.
Yeah, they tend to be too long, and then in an emergency situation, we're not the only people asking these questions, but other agencies. So there's that fatigue from the community members. It's just too much. Yeah. I wasn't able to open the complaints database on Tuesday, so hopefully I'll be able to do it now. So it's got basically 3 tabs. Yeah. So this is kind of the initial one where you get to record. And if you can't do this, obviously, on an Excel sheet, we ask you to reproduce it on a logbook or something like that, whatever works. If your mechanism is at community level or partner level where they don't have access to and we'll share this with you. So, so date received, what sort of entry point, name, sex, age. You've got drop-down menus for those to make it easier to record. So we're just doing child and adult. We're not entering the age and then grouping it. It's just too much work. Phone number if possible, location, sector program. So this sector program list is a list that we took from the, the SCI, I came to for that. The SCI definitions of sectors, basically, yeah? And it is these, and then for emergencies, for example, there's emergencies, general emergencies, protection, education, health, and then other. It might not be necessary, the complaint may not be related to a given program. So we wanted to put in that other category to give that flexibility. Name of project, description of complaint. Does the complaint want a response, yes or no? Then the categories are there, 1 to 6. And then who is it referred to? Description of resolution. Staff member who communicates it and date closed.
Where is the feedback?
Feedback and complaint we're using interchangeably.
Okay.
Yeah? So if
I mean the feedback to the beneficiary, like to the company.
oh yeah, it's there.
There is resolution.
Response.
Resolution, okay.
Response. Now, description of resolution, action, or response, and who communicated the resolution. Now, when we use feedback, it gets a bit confusing. Our feedback on the complaint, but yeah. Okay, so the analysis is here. So the first bit of analysis is by category, yeah? So, and it's by quarter. And so it gives you that automatically from the data that's been entered. There's formulas in there that do that. We've tested it several times, so hopefully there are no glitches. Analysis by sex and age, so male, female, by quarter, and then also children and adults. We see that. And then there's the analysis by sector. Yeah, for every quarter, then you get that also automatically populated. So the idea is that the breakthrough countries will use that in their quarterly reports they can send these to me, the databases to me, and I do a collation, global kind of collation of. It's all manual and not very high tech for us when we collate these things, but we will try. We have been trying for the last 2 years, so Claire and I will be working on this next week, for example, to see you know, how many projects in the 15 countries have been recording, how many complaints are they getting, on which categories, and then by sex and age. We will try to publish that in our accountability report.
But there might be a way that you can code this so that when you collate it at an international level, it's more simple, like we do with visual image.
Yeah.
So we could talk about that.
Okay, that would be interesting. Now this, as you see, it says it's 2013. Yeah. So the formulas in this analysis sheet are for this year, because you have to put in, like, oh God, how do I explain this? Because you're going to put in a date here. Yeah. And that information is taken for the first quarter, so between January 1st to March 31st, that gets collated under, you know, quarter 1, and then analyzed by the different things, yeah? And for that, you have to put in a year. So this database is for 1 year. For 2014, what you have to do is unprotect the sheet. So wherever that is, you go review, unprotect sheet, yeah? You click that. The password is complaint. And then use find and, what is it? Use find and replace 2013 to 2014 in the sheet. And with each quarter 4 formula cell, you have to replace the ending year to 2015, to the following year. That's the only thing you have to do, and then you can use it for the next year. Because for the formula for quarter 4, I think has the next year in it. So
Okay,
I think it's like, you know, from, oh, it's not, I don't remember the form. I won't be able to explain it. Yeah, go ahead.
Okay, if I want to do some sort of changes, maybe small changes, I want to add some row or some row information, I want to will this template will allow us to do that change? Like I want to include a project section, so that maybe like our team sometimes they want donor specific or project specific complaints. So if I add a column, will it allow me this template?
If you add a column
If you
where,
go to the main, yes,
yes.
this one. If I add one column for project, maybe at the end or maybe at the start, for my own.
And if you want that information to be analyzed,
I will do. I just want to ask that this template is not protected for changes.
this bit is not protected. I don't think this bit is
It's not protected.
Yeah, this is not protected. You have to enter information onto this. Only the analysis bit is
Okay.
protected, but you can unprotect it if you want to add different bits of analysis to it. So try, and if it doesn't work, get in touch with me. If you work this, I mean, this is quite simple stuff, quite simple Excel information. So if there's anyone comfortable with Excel in your office, they can fiddle with it and make what you want out of this, I think. Yeah.
There is a column with that.
Yeah.
Yeah.
Okay, good.
Yeah, no, there is. There is. Name of project, yeah. So this is the thing. The last thing I wanted to give you on CRMs is a CRM monitoring and evaluation questionnaire. So sometimes we set up CRMs and nobody's using them. We're not getting anything. That doesn't mean, oh, we're doing such a good job, we're perfect. It just means that our mechanism is just not effective. It's not relevant, it's just not the right thing. That people may not know about it. Yeah? So this is some sort of a questionnaire that Hat put together. I kind of adapted it from them. And it's just a check just for our own sake to look through. So that's it from me. Thank you for a very nice morning session. I really enjoyed it. I hope you have as well. Shall we take a break? Shall we take a working break or a break? Break. Yeah? Let's take a 15-minute break and then we'll look at practical issues. Thank you.
Got that eye on the prize.
I didn't write it down.
There's a little game you can play with children on information sharing. It's called Perfect Soup. So you bring a little pot or something, or just a charcoal board, and you can bring different colored cards. And one is chicken, for example, one is carrots, and one is potatoes. So on the chicken cards, they write what they already know about, say, the children and the project. On the carrots, they write what they would like to know, yeah? And then on the potatoes, how they would like to find out. It's an activity around exploring the best ways of information sharing with them. Okay. And how can we support them in delivering accountable programs to communities together with us? And if you remember on the first day, this is kind of the triangle I showed you. This is our focus in terms of implementing accountable programs. We have a zillion many stakeholders and need to be accountable to all those stakeholders. But we want to be accountable first and foremost to children and their carers. And in order to be able to do that, we need to be accountable to our partners. We need to model that relationship in our relationship with our partners. And this is a conversation ideally I would like to have earlier in the week. So the first day or the second day, but because of the certain kind of logistical difficulties, it kind of was pushed to this day. So we did, a lot of thinking and reflection around assessing our accountability to children and communities in the first and second day. Asking our staff, asking communities their opinion about our accountability to them. Now what I want us to look at is a way of actually introducing this whole idea of accountability to our partners. First of all, the discussion should, start with something like accountability is not new. We are doing it already. Yeah? And it's not a separate project. It's about our ways of working. It's about our relationship with communities. And we want to start getting them to think about what it really means with a reflection, first of all, about accountability in our relationship. So this is basically a simple reflection tool again, adapted from Oxfam GB. We designed it when I was there, and when I came here, I just nicked it. But you know, I just say in the bottom it's been adapted from OGB. So I always, you know, even though I wrote it when I was there, I have to kind of give credit, yeah. So when we want to talk about accountability with our partners in a given project, when we're having a meeting with them, or we can set up a meeting with them, bring them and say, okay, this meeting we talk about accountability. And these are the SC questions. These are questions for our staff. So I want you to first take about 10 minutes talking, you know, thinking through these 4 questions. There's 4 areas on the sheet: transparency, participation, proactively seeking feedback, monitoring, evaluation, and learning. You can give yourself a score from 1 to 4, yeah? In those areas, there's this best practice explained on top. So read the best practice, give yourselves a score in terms of our accountability to our partners. Let's do that now. Staff, feedback from female partner staff. It's about, let's see, yeah, I think so. I think it's something like that.
Because it's not, I'm just saying this is not particularly clear for the best practice.
Yeah, it is
Like,
not.
how does it be
not,
different
yeah.
from male and female staff?
Yeah, I think we need to make that clear. They put these things in later.
In the 3, proactively seeking feedback. In the line 4 is SC.
Oh, yes, thank you.
Because you were thinking before the monitoring, evaluating and learning, and when we're using the action in MEL as well, then I think there might be some worth in trying to separate out those things in best practice. Because I think often you might find that field staff, for example, will engage with partner staff for data collection for the monitoring, but that doesn't mean, and so they'll be like, oh yeah, we involve partners in M&E, but actually just involving them in asking them to do the data collection is not involving them in monitoring, evaluating and learning.
Yeah.
So I think there might be some worth in drawing that out a little bit more.
Okay.
Because I think perhaps people might be too quick to think that they're doing that.
Okay. No, absolutely. If you can suggest, any improvements to this and share, I'm happy to make it better.
Like about the learning, it might be nice to have a separate one that says partners regularly meet to discuss M&E feedback and lessons learned are discussed and integrated into project designs.
Yeah.
Can we instead of 1 to 4, low and high, can we make a checklist for tick mark that are we doing this or not? Like for example, in the participation section, there are so many things. Like planning the budget is 1. Any associations for policy work 2. implementation 3.
Yeah, I
change,
see.
yeah.
Separating
Yeah,
it out.
it can be a checklist, yeah.
No, absolutely.
Mm.
I mean, it's just a starter for a conversation, this one.
Mm.
You can talk about so many other things
Mm.
under each of
Mm.
these headings,
Mm.
yeah? It's really to get stuff, you know,
Mm.
the discussion started.
Mm.
So, if you can do it,
Okay.
basically, you have this meeting with the partners and say, let's have a conversation about accountability. And the partner staff gets, your staff gets this question, and the partner staff gets these questions. So simultaneously, our staff are answering the SC questions and the partner staff are, the questions are the same. Yeah? It's just worded differently for the different audiences. And then at the end of it, you can make a little comparison discussion. Go one by one, transparency. So what was the SC staff score on this? Yeah? And then what did the partners give us? And a reality check on, you know, discussions. If you think that the relationship is sensitive, it won't work to do it at the same time, what you can do is actually, or if you think that the partners won't be comfortable actually honestly scoring us or coming out with criticisms or issues in the presence of our staff, you can send this questionnaire to them in advance. Yeah? Or you as the program manager can meet with them separately without our own staff, just to have a discussion. I want to get your feedback on this. We've sent the questionnaire to you, you've seen it before, what are some of your thoughts? You know, whatever suits the situation. If the people are, the relationship is good, they can feel free to, you know, openly discuss challenges and criticize and comment and take it well, then open discussion. It makes for a lively discussion, let me tell you. He was like, you know, 4 maybe, and these guys, he was like 2.8 or something like that. So you can do it with multiple projects and then take averages and stuff like that. So it depends on what sort of environment you have. So it makes for a very nice, and then you talk about, okay, why are the differences in perception, and you know, we want your recommendations and they give you their ideas.
Would you expect individuals to fill out documents or a group to come together to ask the same children questions and the partner questions?
Both.
Okay, either.
Yeah. We've done both. It can be in small project groups or partner groups if it's a larger group, as I said. It can be, if it's just with one partner, individuals fill it and then they give feedback about the relationship. But this demonstrates basically what does it mean to be accountable in the relationship. Before we start talking about accountability to communities, our joint accountability to communities, that's the other thing. If we start the conversation there, you have to share information well, you have to set up and manage a complaints mechanism, you have to make people participate in the program. Without modeling that in the relationship, it just is not going to work. That's why we say, let's start the feedback mechanism first for our staff, then for our partner staff, and then for communities. Well, that's always a challenge when we haven't considered accountability issues from the start of the program. It's new, it's coming kind of parachuting from the sky, there isn't enough resources in the budget, and so forth. And we're saying, well, this is important, this is, you know, one of the basic things about programs that's got to be done. So there's a lot of buy-in that we need to get from the program manager and the team. The team are already overloaded, they've got their work plan set out, and then we're saying, oh, we've got to set up a CRM, oh, we have to have more sessions with children, oh, that's not the, you know, you just got to do these things. But they are just so stretched, and we have to understand that. So I think we have to go with where there's buy-in. We have to go with where there's space as we start, isn't it? And in as much as possible, we have to go with programs that are just starting. And when we can produce examples in a program and showcase to the others, get the managers on board and say, well, the others are doing this SMS thing that's actually giving them a lot of information, maybe we should try it. Try not to do everything all at once, but start with one element of accountability maybe. So you just have to see. I mean, we have to respect people's workloads as well, and sometimes the pushback is not really based on maybe not based on real kind of, I don't know, maybe they're not really busy, they're just not, they don't want to do it, they just push back. But maybe there really isn't space. In any case, if people do not have the buy-in, they're not going to do it, isn't it? So that would be, I mean, I don't know, what do you think? That would be my thinking.
My suggestion would be that it should have been included in the DIP at the planning stage at first.
If it's not,
And secondly, that we discussed a day or two back, that accountability is not something extra. This is normally what we are doing. Those people who go to field, they are actually doing monitoring. They can also do these kind of things. So it's about convincing the people with the logic that these will not affect or these will not overburden, because it's about the perception. And if we kill their perception about this accountability, then definitely that they will. We can say that we will provide you all possible support, and if it didn't work, we'll take it out. So let's see the result maybe for 1 month, 2 months.
so I think I would say starting with, it's not new, you are doing it already. Focusing on 1 or 2 aspects of accountability. Say start with information sharing, or say integrating satisfaction questions into your monitoring activities. Just small things like that. Demonstrating quick wins. Again, easy stuff to start with. And focusing on projects with staff buy-in, and focusing on projects that are newly starting. Showcasing from other projects to show benefits. These are some of the strategies in which we can kind of push and start embedding these things. Okay. So what do you think of this assessment tool? Do you think it makes for a nice start to the conversation? There's all the flexibility in the world to adjust it and to change it and to administer it in the way that is possible based on the relationships with the partner, based on the sensitivities. Sometimes if you have more than one partner in the room, their perceptions might be different, the relationship might be different, so that's also tricky. You may not want to do that. One might rank you high, the other might rank you low. So then there's like, is one better than the other? Are we kind of thinking, you know what I mean? So it brings up those, it can be a bit sensitive. You will know how to manage it. So it's really up to the team. One question that I get asked all the time is, once we start, now we've talked about the accountability in the partnership, in modeling in the relationship. In terms of explaining and supporting our partners in being accountable to communities, one question I get asked is, how do we best explain it to the partner? How do we make it very clear to them what needs to happen from the start to the end of the project? And for that, I can show you. called Mainstreaming Accountability and Participation in Signature Programs, but forget about the signature, it's basically across the program cycle. Yeah? Okay, already. We need to think. Okay. Okay, so can you see well? Is it alright? It's a little bit small, I apologize. So what I will do is quickly run you through the different stages of the program. And I know a lot of this will be familiar from some of the work that you did with Hannah yesterday, because she has a guide on mainstreaming participation in the program cycle. And I asked her, should I not cover it? But I think she said, it would be good to kind of recap some of that stuff. So it won't be entirely new, but I'll do it quickly. We know we won't do this. We talked about the listening project and all that. So the how. In program design, we basically start with ensuring that people understand what we're talking about when we say accountable programming. And we have a film about that. Should I show it? Oh gosh, I forgot about this. It's 5 minutes, so maybe I should show it. And it's going to show you me, and it's going to show you, wait, pause.
Voice, the opportunity to
It's not
influence
pausing.
our work, and the power to hold us to account.
There. It's there.
It's not showing.
No space bar.
Huh?
No space bar.
What does that mean?
Press this
Space.
It's
Smart, smart. This is a film we made during the training last year with the accountability coordinators. Back up. It's under it. Go under. Please. Well done. Let's see how this looks. Okay. Go back. Useless. I think something.
Accountability will help us to look whether we are doing this well or not. Those who are doing assistance have the right to say what is happening. And those who are providing assistance should listen what they are doing.
We should be answerable to the children and this community who we work with. And it is so important to listen to children and give feedback to the children, because we are there to protect children from harm. Under the pressure of meeting our targets, delivering on our accountability to donors, sometimes the space for listening, creating relationships with communities shrinks. And we need to protect that space and expand that space.
I think we need to be really critical in the ways we implement the program. We need to have time to sit with the community members.
Fellow program colleagues do show it, because it brings this, it's called the staff perspectives on putting accountability into practice. And it's really the coordinators from the breakthrough that are kind of speaking here. All right. So what we were saying is at the beginning of the program, it's really important that we make sure that there's understanding about what putting accountability to practices on within our own program team, and also with the partner team. And of course, in design, we're talking about participatory approach, involving communities, involving partners first of all, because we don't even always do that, right? Involving the community, working with existing groups, setting up an advisory board of children. I'm sure you talked about it yesterday, didn't you? So that's program design. And then concept development, we will talk about it tomorrow. We have excerpts that you can insert into the narrative. We have budget appraisal questions as to how you can budget for accountability without calling it accountability. And we have, we need to start talking about meal plans increasingly so that it is part of the detailed implementation plan, and accountability indicators can be put into the M&E plan. We'll talk about accountability indicators tomorrow as well. Finally, check your design with children and communities. Yeah, so you might already been under pressure, you have already a concept note, you've written your proposal. Going back to communities and checking whether that makes sense with them is always a good idea if we can do it. Program setup stage is the most important stage. So we're talking about what needs to happen at each stage of the program, yeah? And making this clear to the partner. So program setup stage is when a lot of things need to happen. First of all, ensuring that our partner and our staff are comfortable to talk about program information, about our organizations, about information sharing, basically that checklist, the template that we talked about. Giving them that information, making sure they look at it and they start absorbing that information internally. And then they go out and they start informing children and communities. There are, we talked about a standard information sharing package. How can we make that easy for our partner staff? This is an example talking about our code of conduct. There are tools, visuals, in addition to verbal communication we can use. And then once we are sharing information, in that initial setup meeting, we want you to consult on a couple of things that will help us afterwards. We want to ask people how they would like to receive information from us. What would work for them? How is information traveling within that given community? For women, for men, for children, how is that currently done? How can we tap into that existing kind of system of information sharing? Knowing that is really a wealth for us, because it will save us efforts and energy and time, hopefully, as we start sharing information. The second question to ask is how they would like to share feedback and complaints. Yeah? You can use that story with the children and adults. You can just bring it up in that initial setup conversation. We want to listen to you. How should we do this? They will tell us things and we will take it from there. And if we do these things in the beginning, then it helps us set up things early on, and we don't also have to separately go and separately consult them. Yeah? It's part of the agenda of the setup meeting. And then planning with children and communities on how they will participate. Yeah? How can we move from consultation to collaboration? Are there existing groups that we've been working with already? Do we have to set up new groups? What are people's expectations? Identifying appropriate representatives. Together developing criteria for selection and things like that. These are things that generally happen at the program setup stage, isn't it? And what generally happens is we have a program design and we come and we say, here is how we would like you to participate. We've designed it already. We're going to set up X number of groups. will do XYZ activities, right? We tell people how they will participate most of the time. So this is a time when we want to check that. We want to reality check it. We want to get their ideas. We want to plan with them their participation. With the partners, we need to agree on how we will share information with the communities, how we will together enable participation, how we will handle complaints between us, and how we will handle complaints from the community. And also how we will, communicate and implement our code of conduct and safeguarding, and how we will together do MUE. And these things need to go into our program MOUs with the partners. Also, one of the things that we need to look at program setup stage is the capacity gaps, isn't it? We may have hired new staff. It's always a challenge when there's a project timeline, but we've got to train staff to get them going. We have to make sure they know the information, they understand the project, they've got the technical skills. I mean, it's a lot. Looking at technical skills, looking at skills for accountability, participation, and also knowledge of safeguarding, how to implement safe programs. And then work planning. We will look at setting performance objectives for accountability after lunch. So if we set those up from the beginning, if it's part of people's objectives, then we can hold them to account. And we can expect that they actually work on it. Setting up your meal system, your accountability indicators, planning your learning events, or putting it in the program plan that you will have these learning events. And exit planning, part of accountability, very important part of our accountability. At the program setup stage, asking ourselves the question of what's our exit plan? What happens at the end of the project? What happens to the program assets? What happens to the community committees we set up? What happens to the partner? And making it very clear to the community, this is the time frame of the project. In 2 years' time, we will be out. In that time, how we will build the capacity of partners and our communities, who will take over key elements of the project, and so forth. Starting to think about those things is part of our accountability. So that's program setup. You see, there's a lot that we need to think about if we want to mainstream accountability from the get-go. Sharing information internally, sharing information externally, consulting, planning with communities, agreeing with partners on implementing accountability, looking at staff capacity gaps, your meal system, your exit planning. It's a very critical stage, isn't it? Implementation. This is then about, you've decided how to share information, you're starting to share information, you're involving people in decision making. Think about that participation, spectrum. People are leading some bits of it, collaborating with us, we're consulting with them. So that's happening. And regularly listening to people via systematized program monitoring and via your more formal mechanisms for when you're not there. We've seen that. And then exit. When the program's ending, it's part of our accountability to communicate about our exit, when, why, and how we will be closing the program. Who they should contact once we leave. Hand over our assets if and where possible. Manage our staff toward the end of their contracts, and share our evaluation results and lessons learned. That's it. That's it. So, monitor and evaluate the quality of the partnership and each other's performance. So that's about that relationship, accountability in the relationship. The second section is outlining expectations about ensuring accountability to communities. And it takes the benchmarks, information sharing, participation, and seeking feedback and complaints from the communities. Learning and continuing improvement and staff competencies are also there. And for each of these dimensions, there need to be a discussion with the partner, an agreement, and it's in there, yeah.
I'm just thinking, what are the partners under the 5 pages of partnership?
Sorry?
I'm saying, I'm just thinking that our partnership agreements under the 5 pages, about 3 pages.
Right.
So I'm wondering how to be taken
Yeah.
to have an additional 1.5 pages.
Yeah. I'm glad you raised that. Part of this session, I invited Katie Stam to join us. Katie works as part of the SCI Partnership Working Group, and she wasn't able to come. The reason why I invited her was that the Partnership Working Group has just finished SCI partnership tools. And these tools are being piloted and rolled out from this year onwards. And as part of the partnership package, there is a partnership assessment tool, there is agreement templates for all kinds of different partnerships. So what I tried to do as Katie was working on these things is I tried to get in there and comment on all the documents that they produced. And one of the things I gave them is this. And so this 1.5 pages actually managed to get into one of their templates. So from now on, the country office will be asked to use the SCI MOU templates. And there's like an MOU template for consultants, for contractors, for government, for all sorts of different partners. And there's one for civil society or something like that. And I think it's in the civil society. But if you're not using the SCI templates, if the SCI template doesn't have it or what have you, as an accountability coordinator, I'd like you to kind of raise this and say, this, can we insert some of these issues, even if it's in part, maybe not all of it, or in summary form. And you can also cite that SCI has adopted this. I have to find that SCI template. I didn't manage last night to print it. So maybe tomorrow I have to bring it.
That's a real achievement then, that you've got it in the SCI template.
Yeah, but I couldn't get it into all of them.
Yeah.
I think there were 2 relevant ones and one of them only has it. So
That's still really good.
it's a partial success.
Yeah.
Okay, so here we are. I think we managed to catch up very well. Now here's a question. Are you hungry already? Shall we go over and have lunch? And then come back here and watch the movie and then start the section? Or we watch the movie now and then we go have lunch and then have a discussion on it?
Movies 15 minutes long?
Movie's about 20 minutes or so. But the thing is, this thing doesn't work and it's really annoying.
So let's do after lunch and try and fix it.
Yeah. Should we just think, because of my, what people call your baby brain, I forgot to give you something else in the last session. After I handed out the MOU excerpt for partners, I was going to give you this example that has been put together by Sierra Leone office. Sierra Leone has had an excellent accountability, learning and development advisor. Thank you. on to this one for us. Thank you. And they've done a lot of work. They've done partnership strategy and tons of work on partnership issues. And of course, when they started working on accountability, it nicely came into that discussion. And they one of the things that they did in their regular, I don't know, they do twice a year partnership workshops, where they bring together all their partners in the country program. And they asked them basically in one of the sessions, how would they like to share feedback and complaints with Save the Children, the partners? They had a discussion and they agreed on a couple of methods, and that methodology was documented in this procedure. And if you look through it with me, it talks about the basics, you know, the benefits of a CRM. The complaint is defined as complaint is valid when, it's not valid when, and things like that. It introduces our 6 categories of complaints, and then basically on page 5 is the crux of the document. It says, how can a partner make a complaint? So this was their agreement. They said, 1, there'll be a suggestion box in all the Save the Children offices. 2, they can also complain by email or by letter in the suggestion box, yeah? And Save the Children will have accountability focal points who are listed in the next page. And so if people want to go and talk to these focal points, they can talk to them about their issues. But for categories 5 and 6, so complaints concerning staff behavior and safeguarding issues, what needs to be done is basically immediately inform the country director by writing by email or letters. So they said, you know, do not use the suggestion box or the focal points for these categories. Write directly to the country director. That was the agreement. You see in the thing, important. Do not put such complaints in the suggestion box. They need immediate attention. Do not try to investigate it yourself, simply report it. So basically, this is the crux of the agreement between Save the Children and all the partners. And what they did is, they basically copied and pasted that bit into their MOUs with the partners. So it's in the MOU, and this procedure is already also kind of available for partners, outlining the basics of the system and the contact points, etc. as well. So that's an example I wanted to share. So for the rest of the afternoon, we are looking at a couple of things. Looking at staff behaviors for accountability. We'll start with watching a film from Myanmar for 20 minutes and then have a discussion. And then afterwards, we'll go into discussing the relationship between child safeguarding and accountability. And we're very lucky to have Christine with us, who's our Director of Child Safeguarding for that. So I hope this film works. Challenges of training, how communities see our staff. It's all about really working with staff and code of conduct and attitudes and behaviors for accountability. No, I'm finished. No, put it up, please. Okay, should we put the lights on? Can you see there from there? Is that right? being trained on accountability, just like our training here, a little bit different.
I think the management support from the start, that was very much important. They own this and they put every effort to integrate this into their program. They were with their staff, they were also paid what is happening. They were consistently providing support and technical guidance to team. So I think that is important. That from the top, we have this kind of stuff.
What else comes out to you?
Like he mentioned that it took about 2 years to change the perceptions of the community and the staff.
Yeah.
So it means that it will take time in any context to be a successful exercise. And it also shows that, they maybe face so many challenges and maybe have in the start or in the middle, they have done so many mistakes, but they learned a lot from that. So I think that the learning process and the time is very important for this.
But I mean, I think it's a very important point that some communities may find it difficult to provide feedback and criticize or challenge organizations who provide them with services. But I think that's very much a cultural thing. And in some cultures, people are more comfortable, just coming out openly and saying their mind than others. This is an example from an Asian culture where, the new guy came to our community, we showed him around, but we didn't say anything because we didn't want to seem selfish. And then the program manager was saying, the people are very hospitable and they're also very respectful. So whatever you say to them, they will say thank you. And whatever, whatever you give, whatever you offer, they will not challenge it. They'll say thank you and take it. And they will not necessarily open up there and then in the first instance to offer suggestions or challenge what you're suggesting. This might be an Asian thing. In other cultures, it probably, and it isn't in my experience, and I'm sure some of your experience, it's different. So it probably does take some time, and especially when we're talking about complaints handling, it's very important the way we introduce it. If the CRM we're introducing is not necessarily based on consultations, if we're bringing in something new, if we're using new technology, this and that, if it's something new and alien and that's something that is almost, Western, not from that culture, it might take time for people to understand and start using the system, and sometimes they just won't. They just won't use the system. But this bit is about really that face-to-face interaction and the staff's interaction with the community and the time it takes in some cultures to build that relationship and to make it possible for people to slowly open up. And if the staff isn't there, maybe it's even more difficult for people to use the system. Maybe, be it a box, be it a hotline, be it something else, but not that human connection. Anything else that comes out for you?
I
That
haven't
reflects
seen,
some of your experience. Go ahead.
Like in this video, we haven't seen any children. Yeah.
Okay. Yeah, that's a good point. We don't really have a lot of resources with choice. What does an accountable staff member look like? Based on what's inspired from the film and also your thoughts and experience, what does it look like?
They are non-judgmental.
Non-judgmental? What do you mean?
So if you go to them and you're either with a complaint or with feedback, you'll get an unbiased response and they'll receive what you're saying and be appropriate in the way that they treat.
Okay, so welcoming feedback sort of thing and not resisting it?
Yeah, not judging you for what you're trying to say. So.
Not judging you, okay. Yes. Any others?
Trustworthy.
Trustworthy. How can we display trustworthiness, I wonder, in the community?
Don't make false promises.
No, making false promises.
Managing those expectations. But also in the video, the woman mentioned that you don't see the people from the head office, you speak to a member of field staff, and they're essentially trusted to take what they've heard to that next level when you come back with a response.
Okay.
So whether that happens or not would be a sign of perhaps how trustworthy you are as well.
So trustworthiness in terms of delivering messages between the community and the organization.
believes in participation.
Yeah. Yes. Believes in participation.
And advocates for it.
Believes in, advocates for, facilitates community participation and also partner participation. Is that right? What else?
Approachable.
Sorry?
Approachable.
Sorry? Approachable, sorry. Yes, of course. Maybe here also. Maybe that. Very nice.
Actively seeks feedback. So
Activities.
Observe and consider child safeguarding policy.
Observe and practices.
Yeah, practice.
Practices safeguarding. Anything else?
We can add to this Save the Children Code of Conduct as well. Save child safeguarding and Save the Children Code of Conduct.
Very good, thank you.
If the person is a local person, speaks local languages, yeah.
Okay.
Can we add one more thing with this as well?
Sorry?
Can I add something with this Nasi comment?
Yes.
Ethical follows ethical or cultural norms.
Follows
Cultural or ethical norms.
and respects culture. Yeah.
I don't know if they necessarily do follow cultural
But
rules.
no, we're not.
They respect
Awareness.
it, yeah.
Yeah, aware of, I agree. Well, most of the time they do actually have to follow it, don't they?
I know, but for instance, in that example where the cultural norm is to not complain,
That's right.
you see what I mean?
Yeah, okay. Yeah, that's right. That's a very good example. I missed something.
Attention to detail.
Attention to detail. Okay. I like where we're getting to. What do you mean when you say that? Attention to detail.
By getting the feedback from the information, making it time to the people, having that time with the community, discussing around the accountability as well as participation, making a lot of time with them as well as for our.
Okay. So,
Just being a careful listener.
very much. Carefully listen. Takes time to be with communities.
Yeah.
To add on to the careful listening is taking seriously people's contributions and concerns.
Seriously.
Honest with community. Honest with community.
Communities, yeah, not making false promises, honest.
There's something else that you said earlier, is that sometimes you have to be courageous, and that really struck me.
Mm.
That's true, that sometimes you will have to be courageous in terms of following on from those but about being a careful listener and attention to detail. Sometimes you might feel like get an inkling for something that you then want to raise with somebody, you know, or to put in a complaint yourself even, as well as obviously being courageous with SMT to try and get accountability on the agenda.
This is very important.
That's right. Courage to raise community issues and things that are not going right. Yeah, something like that.
being a good advocate
Yeah. For
whatever program they're in.
a lot of times, especially in headquarters, we sit around and we talk about, oh, you know, we don't have the time to consult communities, we don't have, generally when we design programs, to involve partners and this and that, and we're pressured by donors, we're pressured by our own internal systems. In our implementation plans, we're again squeezed for time, for not being, you know, we're not able to do participation as much as we need to, and so forth. And we feel trapped, a lot of us, I think, both here and also in the field. Even though we might be a champion for, you know, participation, we might be a champion for listening and being out there, spending more time with communities, sometimes we feel we're under a lot of pressure by our organizational systems. And this has been something that came up in a discussion about the results of the listening project. You know, the communities want, you know, us to take the time to listen to them, to build relationships. They want longer term impact and things like that. And one thing that came out was the importance of humanitarian leadership. And when we said that, we weren't just meaning for, you know, the heads of our programs or the head of the team in response to show leadership. Of course, it is for them to show leadership and stand up for some of what is right, for us to make space to do some of what is right, but also for each and every one of us in our respective positions to exercise leadership and discretion to say, well, actually, I know this is kind of the right way. We know we need to take the time. And maybe we can actually raise this issue with the donor to gain a bit more time. Because if we feel too restricted and if we hold back, we won't even raise some of these issues with the donor or with our manager, or whereas it might actually be possible if we showed that bit of courage to raise these issues and push back and try to create that space for ourselves. So anyway, what else? Anything else?
Is that role modelling? When you say, because you want to champion accountability in practice, don't you? To show what it means and how.
Yeah.
So it's kind of, it's modelling the role, modelling accountability.
Yeah, okay.
Child friendly?
Child friendly. Okay. Yeah. Well, how about technical skills?
I was just going to say for that.
Yeah.
I don't think we've got to think about responding appropriately and in a timely fashion.
So awareness of power. I was thinking about kind of like you only talk to the leaders, you only talk to the men, you only talk to the adults. So an awareness of power is an understanding of how power in a community works,
Yeah.
reaching out beyond
Where is it? Culture and norms.
Isn't it also kind of knowledge of the community in which you work?
Yeah. Knowledge of community. Responsible use of power. Okay. Should I just come to it here?
Ready to hand over power.
Did I put, sorry, hand over, willingness to hand over?
Yeah.
Power, yeah.
like a good sort of facilitator of discussions and sort of asking fair questions.
So about knowing your own weaknesses and knowing when responsibility. Yeah. And transfer.
Knowing your weaknesses.
And biases.
Yeah, nice. Anything else? I want to put technical skills here, because somebody who doesn't know what they're doing cannot deliver. Yeah?
Yeah, I really basically you have to have really good sort of organizational and time management skills to be able to sort of record things properly, categorize the complaints properly, respond in the right time frame, keep all the paperwork straight. I think that's just really important amongst the other tasks that field workers have on their plates.
And then academic analysis as well. Okay. How about communication skills? Have we talked about that? Communicating with communities. You know, it's all tied to, the attitudes, the respectful behavior, the humble approach, the willingness to listen, give that space, and able to communicate to people at their kind of level about all the things we need to communicate about. And sometimes, this is when explaining things that we will not be able to deliver, that people expect from us.
Patient.
Patient, thank you. That generally comes up here. Okay.
And knows that how to like facilitate the community from one point to another point, like change management. How to facilitate the change in the community from one point to another point. He knows or she knows that.
That is mobilization.
Sorry?
Mobilization, yeah.
But that is mobilization, that is not accountability.
Mobilize community for accountability.
Mobilize community for accountability.
Yeah.
I think that makes sense. Like in the video, it takes 2 years for
Yeah.
the community to sort of change their point of view about making complaints.
Yeah.
So something around like helping them have that realization.
Well, I wonder if it's something about respecting and working with cultural norms about certain issues.
Like the community mobilization have 4 steps. Huh? One is the sensitization, then awareness. Yeah. So that person should know those 4 steps technically.
But I think what Nasir is trying to say that that person has the skills to mobilize the community to adopt the accountability practices. So I think this is the question.
Yeah.
Okay.
Facilitation, isn't it?
Yeah.
Facilitating, energizing, and creating the platform.
It was the taker.
I don't know in the previous chapter, I think we have missed impartiality. He or she should be impartial person in the community.
Can you say more about that?
Neutral and impartial.
He should not have any kind of affiliation with any clan, any political or any group which gives negative impression to community people. Or he or she is limited only or focused only to one particular community. He should be impartial.
How to find that person in the community?
Very easy. I mean, we are affiliated with different groups, but if I have my affiliation, I'll show my affiliation maybe at the election time, maybe some other time. When I'm doing somewhere where I come for a job, I'll let you know about my affiliation.
Actually, when we hire person from a target community, I'm like talking with the Afghanistan context. Normally, we prefer people from the local community because for security and these kind of things. So that local person has affiliations.
Yeah, that means you should be acceptable to the community, most of the community. Definitely you will have affiliation, but people give you respect or they accept you in this role.
You made me think about do no harm. Yeah. So I think that's related to do no harm a little bit. Being aware of the power dynamics in the community and not necessarily, exacerbating power imbalances by way of whom we talk to. You remember the listen first exercise. Do we talk to one person? Do we talk to one or two people, many people, or do we really try to reach a broader section of the community? So being aware of that, and also being aware of the impact of our program, say on livelihoods. If we're giving to cash transfers, but the installments we are giving in is just not working for the community. It's such that, for example, they're having to sell their livestock to be able to complement it and buy other things, but they're actually losing their major, source of livelihood. That's actually starting to do harm. So we need to be really aware of all these different ways in which our programs can do harm. So aware of do no harm.
I think also, I don't know if it's covered, I think non-discrimination, it kind of links into impartiality and self-awareness, because a lot of people do have some biases, or they do kind of discriminate. Maybe it's not overt, obviously, but I think you need to be really aware of where you might not be objective, and be aware of that so that you can consciously make an effort not to have that bias or not to discriminate. And that can be really difficult, I think, to realize that. So being neutral, I think, can be challenging for people, because we do all have, we lean towards sort of certain opinions, and that can affect how we respond. We might not take something as seriously. That person complains all the time, or that's a woman, or that's that's that other group. So we don't take it as seriously.
Yeah. Where did we put the power? Back to non-judgmental bit.
Quite a few of them kind of overlap, don't they?
Where did we put the power there?
Well, there was power.
Responsibility.
Yes.
Yeah. I think, humbleness as an attitude. Can I just put that?
Yes.
I think that's very important. It's really important for us to be sensitive about how people might see us, and that covers things about how we dress and how we walk and how we carry ourselves in the community. That reflects an attitude of humbleness, and also, of course, how we speak with community members. I remember a colleague from Gaza, our head of office from Gaza. I don't remember what we were discussing, but he got so upset by the behavior of one of our staff in the field. We'd just come back, and he said something like, "You have to respect people's polity. You can't go around in your best dress. You have to respect culture. You have to cover. You can't just go around in your fancy, even sunglasses. They tip me off so much. Oh my God." ECB project, Emergency Capacity Building Project, they were drawing posters to communicate about accountability. I've got a couple of things here I can show you. There are messages for field staff, and also for communities, and also for senior managers. And they did this in 5 or 6 countries. And I think in one of the countries, in Bangladesh, in each country they hired artists to draw scenes of NGO staff interacting with community members. And in a lot of contexts, the artist came back drawing us sitting at a table when the community are on the ground with big cars. We come in with like sunglasses, things like that. And they were like, oh my God, you can't use these. But it's actually, that's what it is. And they had to redraw, rehire, pay more money. So, you know, it's about how we carry ourselves as well. Thank you for this. Is that, let's take a couple of minutes to talk about how do we cultivate these attitudes in our staff and these behaviors. What do you see? How do you, have you, do you think in our organization we do a good job of getting this profile of staff? Have you had challenges in your positions, in your teams? Quickly.
Regarding humbleness, most of the people say that in my country office I'm very much humble.
Yeah.
But some of the senior people, they advised me not to be humble. Yeah, and but I cannot change myself. So I see this is a very strong characteristic of an accountable person. What I'm trying to say is that, this point is very important, that but these things needs to be documented somewhere else, that needs to be communicated to the senior management team or like these kind of things, that it should be cultivated in the behaviors and attitudes of those people.
How do we do that?
Yeah.
I was in Egypt recently. We were sitting and doing an assessment, just discussing accountability with the partner staff. And one of the young, very, very young, he must be, I don't know, very young member of staff from one of our partners, he said, when I'm in the community, I feel like I'm God. Nobody questions what I'm doing. I love that, like I have to, yeah. So, how do we, and it was great that he was aware of that, and he wanted to change that, and he was coming out with that, and he wanted to kind of give more power to the community, even as a young person. That's wonderful.
I think some of these things I think I talked about.
Yes.
Patience, blah, blah, blah. But I feel maybe for inductions, if we have a session on accountability and we discuss some of these things, because it's always assumed that if you're working with communities, you are like this, but it's not always the case. So maybe to say it out during inductions for
Yeah.
Yeah. For people to not see accountability as, an additional job, but it's something also that we need to embed in our behaviors and attitudes. It's the whole being aware of the power discrepancy and giving up some of that power definition of accountability. That side of things is this discussion. And you might want to actually start the conversation with this. Show this film, have a discussion, and then start talking about how do we put it into practice, how do we hand over some of that power by sharing information, by participation, by opening ourselves for feedback. Yeah?
I'd like to share an example to second what Gloria was saying. In 2010 in Pakistan, we established this accountability or CRM system. And in 2011, there was another emergency. And we received a number of complaints about staff behavior, attitude, or mainly with the rule paper. Then this was discussed with HR, and then it was investigated, and then we found out that there were many staff members who were new. They were not aware of this accountability and what is the CRM, and they were treating the people, the way they thought they should. So the end result was, it was decided between HR and NEEL team and by the senior management that there should be induction session for all those who join Save the Children on accountability day. This is accountability, and as Save the Children staff, when you will go, we expect this behavior from you.
Yeah.
So then the number of complaints were quite reduced, And that was, I mean, accountability was part of HR manual as well.
Yeah, very good point.
They did a complete cycle, like they started a session throughout the country, orient all those who newly joined. So that they are aware first, and then we expect this behavior. So it's very unlikely, I mean, it's not very good that we expect this behavior without training them.
Yeah. Well, that's very nice, and it moves us very nicely into our next point of discussion, because it's important, yes, to inform our staff about our code of conduct and child safeguarding rules, but also for the community to be able to hold us to account on those issues. They also need to know about what sort of behaviors to expect from our staff. And we rarely inform them on these issues. And in Pakistan, one of the signs of success of the CRM was that when they set it up initially, they were only getting program-related issues. I don't know how long it took. It was about targeting this and that, and this is missing, that's not happening, that sort of practical program-related issues. But as they established confidence in the community, in the system, as they inducted their staff, and as they started sharing information about what sort of behavior people can expect from our staff, the people started speaking about the behavior of our staff, which is generally kind of something we don't hear about. It's kind of something that just doesn't come up. So that was really the success of that mechanism, that it was able to do that.
Regarding this,
No, what I was going to add to what Gloria said about induction, because we should be, when we do induction, we should be talking about the values anyway, and accountability is one of those values. So even in the absence of an accountability mechanism, we at least be giving induction to our staff on the 5 or 6 values. Accountability, commitment, there's collaboration, there's creativity. I think we have high value, and accountability is one. So it's a really good opportunity for new staff members to discuss our mission and values, and I think that this kind of thing could really be easily included in the talk that you do on accountability, and the program is really good as well.
So I know this is like black cloud comments, but I was just thinking, when you look at field officer level staff, particularly in my experience, they're kind of the lowest paid staff in the organisation, and they're kind of, they're from the local community, so we need to hire them. It doesn't matter that they're completely unskilled and illiterate, they're the ones that can get us the information from the community. So when you look at all of these skills that they need to have, there needs to be some kind of comprehensive training plan and commitment from the organisation to support these staff. And when you look at programme budgets, I mean, that's currently something that's not there. I mean, I don't know if it's something that you would advocate to the donor for funding, but I think it would be really difficult to get additional funding for that. And
you mean training for what?
For this level of staff, because I mean, things like time management, organisation skills, communication skills, that's something that you can't just do in a one-off production. It's something that has to be continuous. And I think it's just about what Gloria and Catherine were saying, it's the organisational culture. If the will is there at senior management level, then perhaps it will be done, but I think it still has huge budget implications.
And some of these things about attitude and stuff is not going to change overnight. But I think as a culture of the organisation, the induction, it will make it very clear, this is the kind of behaviour we can expect from you, and this not. That needs to be really made clear in the beginning, and also, continuously, so that at least that bit of things could be taken in, even by the lower level of staff, isn't it? But then, of course, all these other technical skills and time management and organizational skills and things like that, those things maybe are not terribly realistic to expect that we will be able to give to our low-level staff in every project, or especially in the first year of the project, isn't it? I mean, we have to be realistic, but I think the behavioral side of it is also very important. Code of conduct and safeguarding rules are kind of the heart of all this, and also it's this attitude about giving up power and awareness of our power is at the heart of this.
One of the exercises, I can't remember if it was yesterday or the day before, we did looking at issues in human resources, and as I led on the human resources element of it. And one of the suggestions was to have accountability written into people's job descriptions, and sort of key elements of accountability to be met when you recruit somebody, and that's something that you can choose from these elements here.
That's excellent. Thank you for saying that, because the next thing I was going to do was hand out this performance objectives for accountability guide. It's in your blue folders. On the right-hand side, and where that.
I have one small point about that, because if like this can be documented as a best practices guide for fieldwork, like accountable person, and then if it can be documented and circulated among with these
It's documented and circulated right now. This is Oxfam. It doesn't matter. Oh, this is Oxfam. Don't touch it. So they went to the community members and asked them, what does a good community member look like? And what does it say? Respectful and humble. Can you read the rest?
Culturally aware, respectful and humble.
Yes.
Transparent.
Transparent, yes.
Which I think it means that you can see through them.
Yes, like a ghost.
Like a ghost.
Like a ghost.
They're open and not afraid of criticism.
Not afraid of criticism.
Listens to the community.
Yes. Careful listener, we've got all that.
Self-aware.
Self-aware.
And emotionally intelligent.
I like emotionally intelligent.
Well, it's empathetic, isn't it? And that's the other way. Having empathy and understanding other people and how they're feeling and where they're coming from.
Yes, and also like able to probably control their own emotions.
Can be flexible and adapt to beneficiary feedback.
We didn't put that. I think that's very important. Flexible.
I'm a little bit, I'm talking about this humble thing. You're very keen on being humble.
Yes.
Well, in a sense, because I think what you want is mutual respect, don't you, between the community and the worker. And in a way, you don't want the worker, you want the worker to be respected by the community. And if you're over humble, if you're too humble, they just think you're not worth spending time with. They've got to have some respect for you, professional.
Yeah, no, I like mutual respect. Yeah.
Is it more like modesty? Because modesty also.
Maybe that's a better word. Yeah, modest. Sorry. Yeah. Thank you. Yeah. So that's the Oxfam guide. And you can see all those quotes from the community about describing some of the qualities of a good community worker. I like that's also, how it's accountable staff member, a good community worker. Yeah, that's how it's phrased. And so this is the guide for setting performance objectives on accountability, on the more kind of getting things done sort of side of things. We thought, people will do things if it's in their work plan. And ideally, in order to get people to start thinking about accountability issues, we want all of our program staff to have an objective on accountability. But, it may not be possible sometimes. When we developed this last year, we sent it to our breakthrough countries. We sent it to our focal points, but also the SMT members, including country director. And some of the country directors picked this up. And they said, well, we actually like it. And they forwarded it on to HR and said, and their program managers, and said, I want to see this kind of used this year. Let's see how many people we can get objectives set on. So that was nice, and we're collating some of that information about how many people in a given country or section members, accountability coordinator, accountability focal points, monitoring and evaluation people, program quality technical staff, program delivery people. There's even logistics, HR, finance, and communication, and advocacy and campaigns people. And the types of objectives that they can put in their work plan that are related to accountability. So take a look, and we hope that you can promote this and use it. Definitely, I would like to hope that the coordinators will have at least one objective on accountability in their work plan, and also the focal points that you choose will have one, at least that. Yeah, that's kind of our expectation.
Like in Kenya program, our current performance management, it's for the ACI.
In SCA, there is already accountability section.
Accountability section, because they have already posted the ACI values.
That's not it. It talks about, I have to pull that out and read it. It doesn't get to the heart of what we're talking about. We have to be accountable to, it's a very generic one. And it's just in the values. It's not an objective. It doesn't say what this person's going to do for accountability to communities. It talks about being accountable for using resources or something like that. It's almost like financial accountability and accountability to donors more than communities. So I'm not that happy about it.
It's in the JD. If you are going to advertise a new JD, it is there.
Yeah.
And it's also in the performance subject of every staff.
Where?
In the performance review. If you want, I can show you.
In Somalia?
In SCA.
Actually,
in the performance objective, HR has included accountability, always value in the performance objective as well as in the...
Is it the same statement as in the values?
No, it's like, if we see to the...
same explanation that's under the values, but if you refer to your job description and you are taking part on accountability, you can explain a bit, and then your line manager can review what you have undertaken in the accountability section under ACI values.
Okay.
Yeah, my experience is that, that accountability is among those 5 things, values. It's not in the performance objectives.
It is.
No, it's...
Can you show us? Why don't we take a break now and have some shift between accountability and safeguarding. So if these are our 6 HAP benchmarks, which of the benchmarks are related to safeguarding? Really? Really? Tell me. How?
Mostly 5, I think,
Obviously. Right?
Yes, and our child safeguarding policy tells us of how concerns are raised and how we handle such concerns. So, similar to those.
Yeah. So whatever complaints handling mechanism we set up, we might be able to get concerns and complaints about safeguarding issues. And so therefore, our mechanisms need to be robust enough to help us handle such concerns, especially where we need to be able to keep the confidentiality of the complainant and the person who is being complained against. Anything else?
Yes, number 3.
Yes, so how about that?
Because we need to communicate what is the mechanism for child safeguarding. In case of any child safeguarding issue, how they are going to share the complaints. We should pass this information.
So we should communicate to the communities about our safeguarding rules.
Safeguarding rules and mechanism for launching.
And how they can raise issues.
And for the conduct as well.
So sharing information on ACS rules and code of conduct.
Can we ask quickly though, how many people are doing that? How many programs actually tell beneficiaries what kind of behavior they can expect as staff? Anybody doing that? No. It's even without having an accountability mechanism, it's actually really, fundamental that we do this as part of our talk with communities about what we're doing with the project. They need to know what they can.
In 6 and 2, there is staff induction that we conduct, learning and continual improvement, as well as staff competency. I think there are two similar staff inductions, trainings for staff.
Okay. Induction, training, support to what is it to
Just I think to improve understanding and knowledge around child safeguarding.
To practice safeguarding. Induction, training, support to
understand and practice.
Understand and practice safeguarding. Nice.
And 6 as well, learning and continuous.
This is
no, it's quite
different.
Can we say that during the ensuring the participation of the children, we should observe the child safeguarding policy?
Yeah. So obviously, this benchmark is relevant because it's during participation of children that we're supposed to safeguard.
So safe participation.
It's not just sharing the child safeguarding policies with the community, but it's also kind of discussing with the community their experiences of child safeguarding issues and using that to inform program design. So that would
that's interesting. Yeah. So seeking community views on safeguarding and improving based on that. Is that?
Yeah, safeguarding issues and then using that to inform design.
Like some of the complaints that you end up getting from communities will, as you're saying, will show that actually this is a safety issue as well. And so then you change your program design to make it more safe and improve it in other ways as well. So there will be, I think you'll see, for those of you who have done it already, you'll see that the complaints often will have a safety component to them.
And on one establishment and delivery, I'm thinking of the requirements of the ACICS, looking at issues to do with the informing staff communities, as this was saying, of our child safeguarding policy, receiving the feedback, training staff and all, that their deliverables expected, which are laid out in the policy.
Yeah. So one of our commitments communities is that we will safeguard their children who participate or involved in our program, and adults who are involved in our programs. We will keep them safe. So it's about making that commitment clear to them, also linked to sharing information. Yeah. And being able to deliver on that. Say, a breach of our safeguarding rules, especially a serious breach of our safeguarding rules, is a worst form of breach of our accountability. If one of our staff or representative is alleged to be abusing a child who is involved in our programs, that's a black, thing on our name for that community. So it's really a very, very, it's the worst breach of our accountability.
Yeah, no, I mean, I think it damages our reputation, it damages the child. It's absolutely, the worst thing that we could do as an organization, and very difficult. undue damage, and we have lots of examples of where, you know, cases even where we've had to pull out of a community because of the damage that's been done in that regard. And not just to do with abuse, but even just, there was a case in India where we did not hot air balloons, but balloons filled with helium. No, not, was it helium? Anyway, they all exploded, and a lot of children were burned. And it was an event that Save the Children was organized. It was like Day of the African Child, or it wouldn't be Day of the African Child. It was some event that Save the Children was organizing. It was all in the media the next day. Save the Children ran this event, and all these children got burned and had to be hospitalized. And that was just because somebody didn't, you know, pay attention to the safety issues before they did the event. So it can really do a lot of damage to us.
Is it on this issue, is it a black mark against accountability, or actually if you respond promptly and well, is it not a good example of actually you being an accountable organisation? So in fact, you can actually practice what you're saying.
You can reverse it.
So you can turn it in, you could turn it into, I mean, I agree it's a very problematic area, but you can turn it into a positive.
Absolutely.
And it's a good point, because if we get reports and if we get allegations and we act upon them right away, the allegation in itself is bad, but what's even worse is if there's an allegation, we do nothing about it, or we don't report it, or we diminish it. That's actually really bad. But if we get an allegation and we respond really quickly, the media comes to us, you know, we can right away say, yes, you know, we take these things really seriously, and we do have this allegation, we're investigating it, and it will be dealt with appropriately. And that actually shows that we're serious about our child safeguarding. So it's not just that there's an allegation, because sometimes people will say, well, if I make a report, it'll make our organization look really bad. No, it'll make our organization look, in a way, look good, because we have the mechanism that people can report, and we have a response system in place. So it's really, really important that people know that we have that.
It has just become a requirement of HAP membership that all of the HAP members now have to report on an annual basis on the implementation of their code of conduct and child safeguarding policies. So in the annual report that we submit to HAP, we now have started submitting the number of cases that have been reported that year and how we were able to deal with it. Increasingly, several organizations, several of our peers are publishing accountability reports every year or every 3 years. And a section in that report is about implementation of the code of conduct and safeguarding related issues. So increasingly, we want to make public that we are able to actually capture these issues and deal with them. And the more we can do that, the more the sector is kind of willing to applaud us as organizations.
I have like two small things to ask. One is that like the translation of the child safeguarding policy in the local languages, because people don't understand. It is in English. Partners don't understand. Sometimes we just give it that this is our child safeguarding policy, and then they take it.
Yeah.
But they don't understand what is in this.
Right.
Similarly, the communities, they don't understand. So the translation into local languages is very important, I think. And the second thing is about the participation. Is about, for example, if children are, we are ensuring children participation. Sometimes we take a child into, say, the children vehicle, or like we take tickets. If it is airline, then it is insured. But if the child is traveling in, say, the children vehicle, this question was asked by one of our colleagues, that if something happened to that vehicle, if that child is injured or anything happened, then our policies don't like cover that thing of a child. Like the policies cover only the children stuff. So they were like suggesting that what about that child if anything happened? So these were my just smart questions.
I would, yeah, because we've had we actually do take those cases quite seriously. I don't know how we respond on a case-by-case basis, and I don't know what policies there are, but definitely we do have a responsibility if a child is injured in our vehicle and we didn't make sure that they had insurance before, we probably shouldn't have been taking them. And so we do have a responsibility. If a child is injured, because of our program, we have a responsibility to that family. And I mean, I know of examples where we have provided the appropriate support. There was but the example of vehicles is very good because last year, I think it was, there were about, over the last couple of years, there have been 31 deaths because of vehicles, just that children either in or hit by Save the Children vehicles. So it's quite serious. And it's a child safeguarding issue. It's also a security issue. We hear about it through the security incident reporting. They share that with us. But we do have a responsibility if they get injured because of what we're doing. So I'm not sure, who said that, but I don't know how it gets done. I'm not sure through what process we provide the support, but we're supposed to,
what is your impression of how well our staff are aware of the safeguarding rules and the code of conduct in the country offices?
I think for child safeguarding, normally we believe that it is responsibility of all staff, but the perception within our team or what I observe is like mostly the program people, they are more aware than the people who are doing cooperation or logistical procurement. And this is, we have also seen a number of cases like our vendors, we have given them contract for some event, and when we go over there, we see that sometimes children were working with those vendors. So that is related to operation, procurement, everything. So their capacity building or their awareness on these child safeguarding is equally important as for program team.
Yeah.
So I think there should be some session for operation team and logistical procurement people, like if they are having a contract with any vendor, they should give a translated copy of our code of conduct, something like this, so that we can avoid these kind of issues.
Yeah. There was recently a case that I came across where the cleaners that were hired to clean our head office were discovered afterwards that they're actually younger than 16. There we were. We knew these girls. Everybody liked them. We knew they needed the money, but we know now they're underage and it's against our own policy and labor law in the country for us to hire them. So what are we going to do? It was a tough decision for the country director, the operations manager, and the accountability advisor. But I think we ended up firing them, finding a way of supporting them in some other way or something like that.
Can I just ask you, this might be going off topic, but when the country office adapts the child safeguarding policy or procedures, is it contextualised for their country, or do they just take the standard one and it's translated?
Contextualized as long as you're not changing the rules. Like, if the rule is you can't, have sex with anyone under 18, but in that country, the age of consent is 16, or children get married at the age of 12, you can't contextualize it that way. It has to 18 stays no matter what. But I think, yes, it's good to, you need to keep basic policy, but I think in terms of how you actually live it on a day-to-day basis, it could slightly change. For example, if you're working in a country where early marriage is a real issue, you might want to put more emphasis on why early marriage is, why we don't support it, what's the rationale behind it. So you may want to put more, in your training, put more emphasis on the issues that are really relevant to your country context. But you can't change the policy. Policy is policy.
I'm just thinking of an example in Afghanistan, in our compound. They were doing some repair work, and it was a team of builders, and there was some children there, they were clearly around 10 or 11. And I went out there and I spoke to our national office colleagues, and I was saying these children look like they're under the age of 18. this is against our policy. And universal laughter. Like, they were just like, they're having fun, they're the builder's son, and there's nothing we can do about it, this is the way it is, blah, blah, blah. And these were people who'd read the policy and signed it. But because it's so against their culture, like everything that was going on, because it was a weekend, they were thinking, it's a holiday, they're not in school, so they can have fun doing building work. So it's kind of, it's not enough giving them the policy, letting them have some leeway to translate it. I was just thinking, does Save the Children have some kind of process or training or commitment that when this gets rolled out to the country office, they have like intense training and sensitization with the staff?
Yeah, they're supposed to know. In the case, that's actually an interesting case, because if the kids just came and they were with their parents, but they weren't, if it wasn't child labor and they were just helping and it was not unsafe for them, I think you need to look at it contextually. In some cases, we have kids who are actually working. The contractors hire them because they can pay them less money, and they're working for like 12 hours, and they're actually building for Save the Children. And people say, well, everybody does it here, it's normal. No, that's a violation of the policy. But kids coming to hang out with their dads who are constructing on weekends and helping out, if it's safe, it would have to be really looked at by the program. If it's safe, if the kids are not if it's not child labor, that would probably be okay. But I'm kind of saying that without knowing the whole context. So you need to really look at it. But I think that's why it's important, if you're designing a project and you know that people are going to be hiring people, you need to say, in this country, people just generally hire kids. What are we going to do to make sure that children are not hired? We cannot hire children for this project. You have to discuss that at the beginning, because if you do it halfway through the project, it will cause a lot of problems, because people will have counted on being able to have access to cheap labor or whatever. So it's really important to discuss it at the design, discuss the risks at the design stage. And there's a few slides that Virtue has on some of the implementation flaws that we've identified in different countries, because people didn't do that risk analysis at the beginning of the project. But in terms of what kind of training is done, yes, the country program is supposed to train staff. Your child safeguarding national advisor or focal point is supposed to be responsible for making sure that the training gets done. Not necessarily doing the training, but somebody has to do the training in the country program. And that's the kind of thing they should be discussing. Real things that are happening on the ground, and how can we deal with them. It's a really good example.
What was worrying about that example though is not necessarily that children were there with their parents, but the response of your colleagues, that they hadn't thought twice that might be a violation of your...
Yeah, it's actually a good point, you're right.
And that's what's worrying, is that they should have been like, yeah, we realise your concern, but it's okay because of this and this.
We discussed it, we did a risk assessment, and we think it's okay, and that's, you're right, thanks for that. I think that's actually worrying that the staff just laughed it off, and they said, and that kind of gets back to this point about biases, and because those kinds of biases, everything that happens here, will prevent you from seeing where there's a real child safeguarding case right in front of you, because you're part of that culture that thinks it's normal. So you have to kind of, I think as staff, we have to get past our own cultural influences, and across all cultures, it can be really, really challenging.
Is this some of what? Is this a good time now to look
Yeah.
at some of this stuff?
Yeah.
So, implementation flaws, some examples to present here from our programs. Transporting pregnant or sick patients in the back of pickup trucks. Buying unsafe toys or playground equipment.
So this is a logistics. So every department has a responsibility, as you pointed out, for child safeguarding.
Mothers queuing for hours with malnourished children without shelter and water. Children engaged as laborers by our contractors. Adolescents engaged in sex at overnight camps run by us. Children walking long distances, getting home late after children's meetings or activities, missing a day of school to collect food or attend our meetings, being stigmatized later labels as Save the Children orphans. Parents punishing their children for being arrogant about their child rights training.
Can we just talk about that?
Yeah.
Do these kind of, do they resonate with you? You see how they're programming quality issues, but they're also safety issues for children. And like this last one, we do child rights training everywhere, and we are always getting the complaint that kids complain that their parents get really angry at them when they come home to, they start kind of bragging about how they have rights. And that's like a programming flaw, because we haven't done the training with the adults first, we've just done the children. And if we haven't designed our program properly, then kids can really get into trouble, and that it ends up undermining our program, but also puts kids at risk of we've had kids saying that they get beaten if they come home, or their parents kind of yell at them if they come home and talk about their rights. So that's kind of like, if there's a real kind of spectrum of really serious harm that's done to children and less serious harm. And we've had other examples, like since these slides were done, there was a case recently in one country program where a child fell into a latrine that Save the Children had built, because they were in the middle of building it, but they hadn't, the construction company that they hired had no child safeguarding training, and they didn't build a barrier around or put up anything to protect anybody from falling into the hole, and a kid fell into the hole. Luckily, didn't die, was pulled out and was okay. And there was another instance where somebody went to do an assessment at a child-friendly space, and it just came out in a report that there was glass everywhere, all around the child-friendly, and kids were having to play in amongst all of this glass. So just stuff like that is just so easy to prevent, but if we don't take the time to discuss the risks at the program design stage, it won't come up. Now, when you do your accountability mechanisms, these are the kinds of things that you might end up getting, and you have to decide which ones are serious enough that have to be handled this way or that way. So it's really important to look at your programs through a safety lens.
I mean, we're going on to how might use come forward.
Yeah, there's just a slide I think that was before. There's two concerns that we have. One is concerns about harm done by the way we do our programs, and another is about abuse, which is a really serious child safeguarding concern. And it's not, a lot of people think about child safeguarding issues as being only about abuse, but it's not. It's about abuse and harm in general. So these are the examples of harm. And then the next slide is, what happens if we hear about abuse? Abuse by one of our staff, abuse by a partner, abuse by somebody in the community.
And in terms of how we pick up those issues, I mean, should we talk about their experience?
Yeah, does anybody have, it would be really interesting to see how well, whether complaints mechanisms or feedback systems in general are picking up on abuse. Because it's a tricky one. It's that whole thing of how much confidence do people have. Has anybody had an experience?
Yes, I think this has been picked a number of times, especially when we talk about Pakistan program. Like, the father was working on a casual work scheme and he was sick. So his family sent a younger child, a careless child, 14 years, 16. So then we have to negotiate with the people, because on the one hand, that person is not doing his job or something, and on the other side, the family, there is a child who is working. So these were the issues which were picked by the system, like the complaint was genuine, but we have to see the both ends.
Right.
So then we discussed with the program team, with the relevant media manager, and we made some agreement sort of thing that it was not a forced decision. The way the child was engaged, and as soon as he was there, he was reported soon after that. So then that person was paid fully, and he was allowed to leave until he was allowed to have leave till he was sick. There were few things which have been taken, as I mentioned. What we are with that most of these things were related to operations or logistics or procurement, because sometimes or sometimes if children are there, they can use them or something like that.
When we set up complaints mechanisms in schools, because we don't actually have any control over the teachers. And we need to really be careful that if we are setting up a complaints mechanism in a school, that the school is committed to actually responding to individual cases, not just like putting in an awareness raising system. That's not an appropriate response to an individual case of abuse. So what I see sometimes is people say, no, we're doing this big information campaign. But we have to actually, the school has to be prepared to deal with the individual cases that are raised by children or by other people. Otherwise, they won't have any confidence in this. Kids won't have any confidence in the system. So we had, there were some schools who said, well, we set the complaints mechanism up, but so far we've received 50 complaints of teacher abuse. And they just had absolutely no way to deal with it. But they hadn't kind of thought through that at the beginning. You know right away if you're doing a complaints mechanism in a school, you're going to have lots of cases of abuse. I mean, you just know that you are. So you need to have a really good discussion beforehand. What are we going to do? Can we actually handle all these cases of abuse? Do we need another agency to come in, like Childline or somebody else, to come in and start to receive them if we ourselves can't do it? So don't set it up in the school unless you know that you can deal with the cases and that the teachers are committed. In this school that I'm talking about, the headmaster hadn't even been consulted. And he was not at all interested. He had absolutely no interest in hearing what was going on. So they set this system up and basically could not deal with any of the cases. So it really undermines our work and our organization when that happens. So if you do a risk analysis about the complaints mechanism before you start, I don't know if you've had any experiences of things going very badly wrong.
We've been talking to Christine about setting mechanisms in schools right from the beginning when we started this work, because in a lot of our countries where we do education work, where do we put up our suggestion boxes? Oh, we have an education program, we're going to put them up in schools. And these are places where, again, we don't have a lot of control, we're not there, and the complaints are not going to be about our project. So we want to start in our programs, we want to start giving people the opportunity to hold us, to our staff to account. But when you put it in schools, it's going to be, complaints about the teacher or the schoolmaster or maybe other students or the system or the cleaner or this or that. And there are so many risks to the children because, first of all, if the school administration and the teachers do not like the system, they see this as a threat to themselves, that the kids are all of a sudden going to start complaining about them. And if the school administration is not able to protect the children who are using the system, if we are not always there to support the administration to deal with all these cases, which is not even realistic, I think, to expect. I mean, if there are, if we're working with 5 schools, if there is like 5 cases a month, 25 cases a month, we need to support. And that's even a low number.
Yeah.
Yeah. So and generally we work in more than 5 schools. So it's got lots of risks. So that's something we really want to caution and discourage, especially if the school administration is new. It's some idea we're bringing down from the sky or something, and they're like, okay, what is this? Should we do it? Should we not do it? If they are asking for it, that's another thing. If they're asking for it. In Tajikistan, the school administration really liked the idea. We trained them, we helped them set it up, and we had kind of full confidence because they wanted this system. And the teachers were, initially I'm sure they were a little bit like, but then they bought in and, they responded. Okay, this is some sort of education for our children. They are okay with being held to account. But in another country office, a girl was abused by a doorman. He was touching girls all the time. And she used the system that we had set up to complain about this. And the complaint got out. It went were not able to protect the name of the child. The child was cornered and beaten and further abused. And on top of that, the school administration refused to fire the doorman. This guy was there. Everybody knew about the girl. I mean, it can get very messy. Yeah, so I think there's a lot of risks involved, and we want to discourage that. So if you come to me to say, we're going to set up CRMs in schools, you're going to get lots of questions and pushback and a nice piece of guidance that we wrote together with Christine on this. We do not want to encourage this.
So in that example,
Yeah.
is that how it was left? It says the children still have involvement with that school.
The school administration wanted to kick Save the Children out. They said, get out, we don't want your project, we don't want your CRM. And the accountability coordinator put down her resignation because she felt so responsible. And then I think after some negotiations and stuff, the school administration was pushed to fire the doorman. And I think our relationship with that school, kind of was shaky for a bit. I'm not sure if it continued. But yeah, we retained our staff, but it was just really difficult.
We didn't give up.
Imagine it's just, from this idea that, let's set up CRMs and let's pilot this system.
Sorry, on the two things there. One is that our definition, as you presented it, of CRMs had that thing about only doing it over issues over which we had control. And clearly we were introducing the system into a place where we didn't have control.
We didn't have control.
So there was that issue first. And the second one was that it was an issue of program design. We were doing a program that we weren't working through the implications of what we were doing in terms of introducing a mechanism into a school that we didn't have any control. We hadn't got buy-in or ownership from the school. So there were two bad things there.
Yeah, absolutely.
But it's not,
We ended up,
And
but it's not what?
Well, strictly speaking, it's not an accountability issue, because the issue is a programming issue. I mean, it's
But it came in because the program staff thought that we wanted to introduce an accountability mechanism into this project, and wrongly they set up the project to hold
but it wasn't
not ourselves account.
It wasn't our staff.
Yeah, exactly. So there's that misunderstanding there, and that's something I had to really try to explain, that our mechanisms need to first and foremost hold us as program staff and our organization to account.
See, it's
not others.
Yeah, it's really tricky because if we have a partnership with like little NGO where we're contracting them, they have the same child safe. They're accountable to us for their child safeguarding. If they abuse children, they're accountable to us. We can terminate the contract if they don't properly respond to child abuse. And that's with like the little NGO that we're funding. The Ministry of Education is really tricky because we have to have an MOU with Ministry of Education. They technically are a partner because we're funding a school or we're funding teachers or whatever, but it's really hard for us to hold teachers to account because they are under Ministry of Education, and we're not going to terminate a contract. Technically, we should be terminating a contract if they don't handle the abuse properly. But because of the work that we do with ministries, it's a really funny kind of relationship. But it needs to be really clearly stated in your contract, in your MOU with Ministry of Education, that you have an expectation that if there is a case of abuse by a teacher in a school that we're funding, that you expect them to respond to that individual case of abuse in the way that the Ministry of Education responds to cases of abuse. And they can respond to it in their own way, but something has to be done. They can't ignore it. And I think a lot of times we feel like our hands are tied because it's Ministry of Education. If they refuse to respond to it, if it was another partner, we would terminate the contract. But we can't terminate a contract with Ministry of Education because we'd be shooting ourselves in the foot. So it's a really tricky one with Ministry of Education. But technically they are a partner. If we are funding a school, they are a partner.
Wouldn't that be something that you could address during implementation, that you would then have a separate MOU with the headmaster or mistress of each school?
because that person would be responsible for hiring and firing.
Something you have to somehow discuss that you have to have it in your contract that you have an expectation. If they have a complaint against the Save the Children staff, they should have the expectation that we will respond to it when they report it to us. Likewise, if we get a complaint about one of their staff and we report it to Ministry of Education, to the headmaster, to the regional education officer, whatever the reporting mechanism is, that they will respond to that case. And saying we're going to do an awareness raising campaign is not an appropriate response to a case of sexual abuse or serious beating in a school. We have to hold the Ministry of Education to account, but that requires more than just the program staff at the ground. That's like a discussion that our country programs need to have at a higher level, which isn't happening at the moment. But I think I've been talking to education people to try to get this. It's really important that we start to hold education ministries to account for child safeguarding when we are funding that project.
Does that apply also to basically to other ministries? So Ministry of Health, for example, if we're working with them?
Yes. I mean, it can get really tricky, yeah. It's one of those areas of child safeguarding that we haven't really worked through yet. I think it's easier with schools because there's teachers and schools are notorious places for child abuse. And we hear about child abuse all the time, but we don't know what to do with it. We just say, well, everybody's doing it and we're trying to address it and we're what. But if we don't hold them to account for the individual cases that come to our attention, that's where we're failing in our commitment to protect children. I think we have to have more courage and really hold teachers and Ministry of Education to account for those individual cases. Sorry, we kind of got off track.
No. So should we get back to how we might hear about abuse? You might hear, suspect, or be told about it, about a staff member or representative abusing a child via professional role and personal life. You might hear about serious abuse being perpetrated by someone outside the organization, by the community, by a community member. You might hear about abuse exploitation by other organization staff. But reports are rare.
Yeah, I mean we don't very often get reports, but I think that the complaints mechanism is a really good mechanism for reports to start coming, because I think up to this point in time we have really good mechanisms for responding to reports, but we don't have good mechanisms for getting reports. And we just kind of passively sit in our offices and wait for a report to come in. This mechanism has really great potential for us to start getting that kind of feedback. And it might end up being something really minor, like somebody might say, well, your staff member is always acting kind of weird around one of the children. That actually might be what you get. And when you really start to look at that, it could end up being an abuse case. And so you could start to, that's why I was wondering whether you've got, are you starting to get some information from the community about abuse? And you've mentioned community abuse and you've mentioned the teacher. But yeah, I think this mechanism is a good potential for us to get more. Because for the size of our organization, we're not getting enough reports. Like HAP has said to us, your organization is too big and too complex to get the small number of reports that you get every year. And we think it's because we don't have good mechanisms in place to receive information. And this is a really great potential, I think, for us to get a better handle on that.
One bit, I would say, underreporting is the classic reason why, underreporting we know is a major issue with child abuse. So, the mechanism can be in place. You've got to develop the trust in the mechanism. It's only by demonstrating that it's used, you're responsive and so on, that actually, then you begin to stimulate the kind of reporting.
Yeah.
Because otherwise they don't trust it.
Exactly. There are mechanisms that have been set up solely to seek reporting on sexual exploitation and abuse issues. There are organizations who have been kind of experimenting with that for a while. And HAP comes out and says that they are actually against the idea of setting up mechanisms that will look solely at sexual exploitation and abuse issues. They recommend that we set up complaints and feedback mechanisms, and they cover a variety of issues, including program implementation issues and staff behavior issues that will be about breaches of our code of conduct and safeguarding. And that's because basically sometimes a report that might be about a minor issue, a minor, I don't know, program-related issue, where you dig deeper, might unearth some more deeper issues about safeguarding or a code of conduct. But again, whatever we set up, when we set the scope of it to include breaches of code of conduct and safeguarding, those mechanisms need to be robust enough to be confidential. The principle of confidentiality is very important. Otherwise, there's risk of doing great harm. Confidentiality protects both our staff, because if there's an allegation and they're actually innocent, but if we do not protect their name, so that's a kind of a very kind of blacklist-like thing on their name of that staff, both within the organization and within the community, that will affect their life, their work life and personal life. And it also is important for obvious reasons for the person who has been, say, abused and who has come to complain. And in some communities, in conservative societies, if a child has been abused and if we're not able to protect their name, there are traditional mechanisms that will come into place, and we will be kind of really marginalized in that. A kind of group of elders will take over and sometimes maybe go and kill the perpetrator, the alleged perpetrators,
or even
retaliate, or even the child. So very serious when we talk about robustness. So that's why this is a crucial part of our categorization. It's a crucial part of our kind of SOP, the Standard Operating Procedure for Complaints Handling. Child safeguarding is in there, but as we say, as Christine just said, our complaints mechanisms will be only one way that we will pick up such concerns. If they are there, if they are functioning, if people trust them, we might start picking up such concerns through our complaints mechanisms. And especially if people know what behavior to expect of us, then they can hold us to account using these mechanisms. But it is likely that in the absence of these mechanisms, or in addition to these mechanisms, we will continue or hear about safeguarding related complaints verbally, I don't know.
Through M&E, through evaluations, yes. Assessments, just going out, observing things. And there's lots of different ways that you can pick up on stuff.
The CRM will not be the only way. Sometimes by its nature it won't be, kind of suitable for people to trust it and share it. Maybe people won't be comfortable writing and putting it in a box. If the only mechanism we have is face-to-face talking to people, to our staff, maybe they won't be comfortable coming and talking to us about these issues. I don't know. So it will be one way, and we will keep getting them through other ways that people feel comfortable raising it. And they will raise it as long as they trust us and as long as they have information about our code of conduct and safeguarding rules. So, just to remind you of the flow chart, category 4 and 5, basically, whenever, if it's a safeguarding related issue that we get through the mechanism, the child safeguarding policy takes over. So the issue is communicated by the accountability focal point directly to the child safeguarding focal point or the country director, whichever is going to make the response faster.
Yeah.
Yeah? Is that correct?
So it will depend on your own country program, what you have in place, but generally you want the information to get to the country director as soon as possible, and it's supposed to be within 24 hours. And if your focal point is quite a senior person at the field level, then it might go through that person. If that's a junior person, then it's probably better for the complaint to go directly to the country director. But again, you need to look at your own country context and decide what's the best way to do this that will make it safe, confidential, and quick.
Yeah. Again, coming to one of the key tools, the complaint and feedback reporting form. If, say, one of our staff is doing a monitoring visit there in the field, somebody approaches them and tells them about a safeguarding-related concern. Everybody who is using and filling these forms need to understand these categories and the seriousness of confidentiality if it's a category 5. Yeah? So if they deem that what they just heard is a category 5 or a 6, they need to keep it confidential, do not investigate it themselves, bring it to the safeguarding focal point immediately.
Can I ask, do all of you in your country programs, do you currently have child safeguarding reporting frameworks? So do you know what to do if you get a child safeguarding concern? Do you all have a reporting structure already in place?
Do you mean focal points? Like how
like focal points.
How information flow.
How the information is going to get from where it's first learned about to the country director as quickly. Do you all have that kind of a process in place?
In the Kenya office, we had posters in the toilet to recommend what to do if this happens, which I thought was really good.
This is for training program. We do for Somali program, but I think those are old one, and after SCA.
Oh, right, that's happening.
So it's a minimal requirement. You have to have those mechanisms in place. So it should be your child safeguarding focal point or advisor who leads that process of putting them in place. But when you come across a category 5 or 6, as Virtue was saying, through your complaints mechanism, it diverts right away to your child safeguarding reporting. It just goes this way and it goes up the, yeah.
Okay, I have 2 questions. Maybe it's on the little silly. First question is, if a child has been physically abused in a school or somewhere, we are supporting the school, that needs to be reported to a country director?
Well,
as per child safeguarding, if it says physical or sexual abuse, so what do you say, that should be reported to country director?
I mean, normally if it's a community level case, if it's an external case, somebody out in the community is abusing a child, where it gets reported within the framework is if it's a serious, like a crime, a really serious physical abuse or sexual abuse an abuse that's in criminal in nature. Now, if you have a strong child protection program on the ground, that program can probably deal with that external case. The country director needs to be informed at some point, yes, but your child protection program on the ground is likely the mechanism that will respond to the external abuse, community level abuse. Where it's a teacher, again, it's tricky because of what we discussed earlier. So you kind of need to decide at the country level how you're going to deal with, with teachers. If it's a Save the Children staff member or a partner member, yes, it has to go straight to the country director. Sometimes what happens is it will be done in parallel. Somebody will tell the focal point and the country director at the same time. But the idea is to get it up there. We don't want this cumbersome layering of reporting. It just has to get to the country director. At the country director level, what happens is that at that level they make a decision on if they have enough information to investigate it. If they don't have enough information to immediately start up an investigation, they might send somebody from the country level down to the field office to collect a bit more information, and that person would go to the source, whoever first reported the information. And then a decision is made on whether or not to investigate. and then the investigation takes place very confidentially by not by anybody who's in that field office. It's all done by people external to the field office.
Okay, my second question, which is related to my first question, is that like maybe Nasir and Haji from country program, they agree with me. Like we know that children are normally physically abused. It's a culture, or they don't mind. And
They don't mind?
I mean, yes. I mean, if they are fighting,
Yeah.
then they feel that it's normal that children, if they don't do homework or something, they will be beaten by their teacher, and it's not something very unusual, even if you are in a good school. So my question is, when we see the child safeguarding policy, it says about physical and sexual abuse, but if we see the context of some countries or some culture, we are a little bit flexible, maybe somewhere, because we are very much strict on the sexual abuse, but a little bit flexible on physical abuse.
You just have to be careful. If it's physical, if it's an external case, if it's physical abuse of a criminal nature, where a child's arm is broken, where it's like quite serious abuse, we have a reporting responsibility. We can't, if it's serious abuse of a criminal nature, if the abuse is taking place by a partner staff or by one of our own staff, it's abuse. It doesn't go under the cultural acceptability. It's abuse. It has to be reported internally right away. But when it's community, a father is beating his child, and you know about it, I mean, that's something that you have to discuss at the country level, that you really shouldn't accept abuse, but you might because it's culturally acceptable to do it. But abuse will continue. If somebody's being constantly abused, it could lead to really serious damage for that child. So as a country program, you need to really have these discussions with your staff, because if everybody's just accepting, constant abuse, if it's a problem in the community and you're running a child protection program, your child protection program should be looking at that kind of thing. This community has a lot of early marriage and a lot of, physical abuse by children. How can we incorporate that into our child protection program so we can start to shift the way the community perceives abuse? Look at it from however they do it. If you don't have a child protection program, it's really difficult, because you have no mechanism to kind of address it. But if it's serious, it should be reported to the police or whatever your local mechanism is. So it would get reported up to the country director, but also to the authorities, the proper authorities, if it's an external case.
As per local procedures.
As per local procedures. So that's why you have to. It's not like the same, recipe for every program, but be really careful about saying things like, we're kind of more tolerant of physical abuse because it's acceptable. Just be really, really careful about saying that, because if it's happening, a child could end up being very seriously harmed. Doing education programming in a community, we can't be doing, building my punishment here. Myself, I don't think we can be doing education programming without a protection program at the same time. We know that there's so much abuse in schools. And I was actually recently in a country program where they were only doing education programming, which meant books and pencils and stuff. And nobody was addressing the protection issues in that school. And as soon as we start to work in the school, we're going to be confronted with protection problems. Do you want to jump in? Because I don't want to be saying something that I shouldn't be saying, but it's really difficult because our hands will be tied if we're not running a protection component within that education program.
Well, I totally agree with you in one sense. The problem we know is the whole issue about who's going to fund the protection program. So if somebody's prepared to fund it, in that sense, then yeah.
Or protection
Well,
components.
why don't we design integrated programs like?
Well, I think we're getting closer to that.
Yeah.
There's a lot as well.
It just makes,
on this other issue, reporting, because that's, again, the ideal is in a situation in which it's safe to report to the authorities a crime and so on, that's fine. But at the end of the day, what's the most important thing? Is it the kind of doing what the law says, or is it the best interest of the child?
Yes.
And be very careful about, because you could, for example, in the case of a father abusing a child, you can increase the risk to the child. If the father knows that they've been reported, you could get them in trouble with the police, so the police kind of take the child away. And we've got instances, you know, in many countries where the children themselves will be placed into institutions or detention as a victim.
And that's, yeah, that's actually, thanks, that's actually a really good point. And that's why you need, like, every country program has to develop its local procedures according to those kinds of things. If you're working in a community or a region where you're quite likely to put that child at very high risk of further abuse if you do report, or you know that the police can be bought off really easily. If you know your own program, you know your own places where you're working, you need to have those discussions, and you just need to say, well, what happens then? What happens if we do have a serious case of abuse? What is the best way to report it? Maybe it's not to the authorities, maybe it's to the community women's group who deal with these things. So that has to be clearly written in your local procedures so people don't start to ask these questions when an abuse is actually taking place. When the abuse takes place, we need to know, how do we respond? We can't do anything, we have to do something, but we have to do the right thing. So it's a really good point that you're bringing up. And there's usually some group in the community who is looking out for children. It's pretty rare to find a community that just doesn't care about children being abused. There is somebody, you just need to find who they are and make sure that that's where your referral goes. And they will know how to deal with it in a way that protects the child. And that's part of the work that you need to do with them in advance as well.
Now, after the transition, we know that especially after the transition, there are country offices who do not have these local procedures in place, or who've got, kind of old ones that need to be relooked at, and the new SMT is not necessarily aware of the fact that we need these procedures. Do you know what SCI is thinking about pushing this forward, and what guidance exists already for creating these procedures? Who needs to be involved in this process?
Well, there is a document, there's a guidance document for developing local procedures, so that's there. And the absolute minimum is that you have procedures in place for if it's our own staff and partner staff who are abusing, or other NGO staff. But you also need to eventually get your procedures developed for external cases of abuse. But yeah, there's a guidance document that kind of walks you through how do you develop your local procedures.
Who is involved in that process?
Usually it's the Child Safeguarding National Advisor or focal point working with the senior staff in each field office to do the local procedure. Because if you have like satellite offices, you need to have a local procedure for each office. Usually what happens is that the local procedures generally are developed for the country program, and then at the field office level, they're slightly modified to the situation. Like there was one case in a country I was working in where the local police in one community were really good and very responsive. In another community, they were not at all, and so they just slightly changed who received the reports. In one case, they gave the report to the police. In the other case, they gave it to the community child protection group because they were better equipped and more interested in handling abuse cases. So that's part of developing. It could take a bit of time to develop it for external, but at minimum, you have to have something in place for reporting and responding to our own staff and partner staff abusing. And that includes immediate emergency treatment for the child if it's something like sexual abuse or physical abuse. We have to look out for the child as well. Like the 72-hour window that we have for PEP is really important. Does everybody know about that? Yeah. Post-exposure prophylaxis. It's actually an area that we're not doing so well on. We will hear about an abuse case and everybody's talking to the child and other people, but nobody's actually made sure the child's gotten to the hospital to have the PEP, which has a 72-hour window. And it's really important for children to get that, or for not just children, anybody who's been abused, sexually abused.
Yeah. Can I just kind of go through these and see what else?
I think we probably covered that.
Yes, we covered that. What are the obliged to report? Internal cases where alleged perpetrator, staff member or representatives, including all of us, or abuse by or between children associated with our programs. Oh, I didn't know that.
Yeah, so children in child-friendly spaces, children in clubs, you know, really bullying is a really serious issue. We need to be on top of bullying and any kind of abuse between kids and get that handled.
And then the external cases, you know, staff and other agency or from the community. These are our obligations report. We talked about this. Do you want to capture this country level reporting framework?
I think we've kind of covered it. You know, the idea is to get it to the country director or the designate, which could be the national child safeguarding focal point, as quickly as possible. And then discussion around what kind of emergency intervention is required for the child and what can we do. If it's an external case, there are certain things that we can do. If it's an internal case, there are certain things we must do. And that's mostly medical attention. And then the decision is made by the CD about whether or not to investigate if it's an internal case. The investigation process is then initiated, and once the investigation has been undertaken, that it's only then that a decision is made about the alleged perpetrator. So an allegation is an allegation until the investigation is completed. It's actually really important to keep that in mind because, you know, as Bertru said, somebody's reputation can be really damaged, but it's an allegation until the investigation is completed. So if that person's name gets out and it turns out to be a malicious complaint or there was, you know, we couldn't find enough information, a lot of damage could have been done to that person if it wasn't kept confidential. And in terms of serious external allegation of abuse, again, you report to the focal point, the country director or the designate. If it's an external agency, like another NGO or the UN, you know, I would suggest going right to the CD because that's quite serious. Also, it's kind of like one of us, one of our colleagues. If it's a crime, then it needs to be reported to the local authorities. But again, that's something that you need to decide at the country level. How does that actually get done? And sometimes, say the children, if it's an external NGO against who the allegation is made, they sometimes will ask, say, the children to help give investigative support because they may not have the expertise to do the investigation. So we often will make a report to another NGO and say to them, you know, if you want some support in investigating, we can provide that support as well. So we can sometimes play that role, work in collaboration with the other agency who's had the allegation.
Okay.
And then there is an incident reporting form. That's what all the key information needs to be documented on. And this last point is actually really important. A lot of times people won't report something because they think they need more information. It's really important, whatever information you get, for example, if you're getting it through your complaints mechanism, you just report what you got and somebody else will look into the investigation. If you start to investigate, if you start to get more information, you can actually end up undermining the investigation. You can put people at risk by doing it. So just report what you have. You don't need to get anything more. It might only be a little, small little bit of piece of information, but if more information is required, then somebody will come back to you and talk to you and say, how did you get this? Can we talk to the person who gave it to you? So that will be somebody else's responsibility. So really important though, because it's one of the barriers that people will always say, I didn't report something because I wasn't really sure, But no, you're never really sure until the investigation is done anyway, so just report what you know. Okay?
Great. Thanks, Christine. I just want to spend the last 5 minutes talking about how can we improve our communication and information sharing about our code of conduct and child safeguarding rules so that we might be able to hear more about what's happening, like in Pakistan. How can we get people to come back to us for feedback on the behavior of our staff? So, do you have any examples to share, from what you're doing in country offices? Have you seen good practice guidance? We need to talk about how do you communicate this to adults, how do you communicate this to partners and adults in community, but also how do you communicate this to children? thoughts? Any experience?
Do you mean about what the expected behavior is?
Yes, what our rules are.
Okay.
Yeah. So this is something that Christine put together. It's a child-friendly version of our child safeguarding rules. So maybe Christine, I mean, the ideal is that to come up with a simpler language that will help our staff to explain these rules to children. But we also want to think about, you know, activities and games as to how we can communicate some of this. Do you want to say a few things about what you've tried and what works and what doesn't?
Yeah, Gloria and I have done some stuff together as well. I mean, there's lots of different ways to do it. One thing that in the work that I do, I often just hold what I call a children's feedback meeting. I'll just meet with a group of kids and talk to them about, well, first of all, I ask them what do they know. Do they know anything about what our rules are? And depending on what they say, I just do a session on, you know, what they think the rules should be, and then explain to them what some of the rules are. And then I just have them go into groups and talk about, you know, where do they think, say the children is doing well, which rules do they think we're doing well on, which rules do they think we're not doing so well on, and what are their recommendations. And I've gotten really, really good information from children on staff behavior, negative and positive, using that. Virtue has done a storyline. Have you used that one with children?
Together, yes.
Yeah, so you do it, same thing through a case study. You just ask children to kind of, you know, talk about the case study and then talk about their experience within Save the Children. But it's really important that kids understand this, because I've had some really interesting stuff come out. I was in one country program where the kids, we were going through some of these, and they said, so you mean like a field officer can't sleep in the same room with a child? And all the kids started giggling and laughing and looking at this one boy. And I said, no, they can't do that. You know, we talked about why they can't do that. And they said, well, that happened. You know, so what happened is that one of the field officers in this program, this was a boy, I think, who really caused a lot of problems. And there was a school trip there's a weekend away school trip. And as a way to manage the child's behavior, he made the boy sleep in the room with him. But not only did he make him sleep in the room with him, there was only one bed in the room. And so they slept in the same beds. And when I talked to the boy afterwards, I didn't talk to him in the meeting. I just said, you know, can we talk a bit more about your experience with this? And he said, well, he didn't do anything. He didn't touch me. And he just said to me, it wasn't about that. But I was just so humiliated. It was more than, I think it was a year and a half earlier. He said, I was so humiliated because all my friends got to sleep in their own bedrooms or with their other friends, and I had to sleep with this guy. And he came in, he was smoking cigarettes and drinking whiskey all night. He had the TV turned on really loud. We had to sleep in the same bed together, and they're still laughing at me about it. And you could tell he was like the tough guy in the group. But this experience had really diminished him as an individual, had really humiliated him. And those kids had no idea that what had happened was completely a violation of our rules. Nobody had ever talked to them about what the rules were. And it was a year and a half later, and it was still a topic of laughter, you know, for the group, because he'd been so humiliated. And the same group of kids said, there's something here that says you can't put children at risk wherever it is, that we will, whatever we do will always not put children, keep children safe. And they said that the same field officers who were involved in this weekend away had put the kids into 2 separate vehicles, and they raced all the way to the venue was about 3 hours away. And the 2 field officers with the kids in the car raced back and forth on the highway to try to beat each other. And the kids said they were terrified. But they didn't know. They said, you know, we just thought that field officers were just, you know, what can we say about it? And yeah, I mean, it was such a simple, it was like a 1.5 hour exercise that I did with them. And all these things came out. So it's really critical if you're working with children, not just if you're working with children, but even if you're working with the children of adults who are benefiting from our program. Because kids will, you know, will say things like, well, you know, you you've had this, cash for work program for my parents, but I now can't go to school because my parents are working all the time, so I have to now stay home from school and take care of my brothers and sisters because of this program. So it's important to talk to not just direct children you're working with, but also others. And Gloria, you've done lots of the children's feedback meetings. And maybe you have a couple of examples as well.
This one that we had across the borders of, I don't remember, but one of the, when we discussed the laws for staff, there were things coming up like inappropriate relationships between staff and children. Some of the boys having inappropriate relationships with staff. And also they didn't know about it. And to some it was more like being favoritism. Yeah, favoritism. Yeah. And other children will get to know, and she would really get status above other children because of that kind of relationship. The children, some children who didn't want it, didn't like it, but because they didn't know it's something that we just pass. So these are some of the things that do come up.
When we did the session in Liberia, they talked about a certain type of handshake that's not appropriate. If the staff does it, it's just so offensive. And they demonstrated it with us, and I was like, wow, that's so they tell you, they know what, I'll show you a couple of examples. So I think we have three audiences here. We have the staff, we have children, and we have adults involved in our programs to communicate the same information to. So I don't know, whatever tools we develop, I think they need to be formulated for these three key audiences. So for staff, it's about how will we keep children safe. For the adults, how will we keep your children safe? And for children, how will we keep you safe? We generally just, come up with posters that, this one is from Sierra Leone. And what they did is they picked up, I think, certain bits of the safeguarding rules that are most kind of important and relevant and most likely to be, violated in Sierra Leone. And they hired a local artist to draw some scenes, develop some messages for do's and don'ts, and produce this poster. And then they, of course, tested it to see if people understand it, if the staff and the communities understand it. Even though this is like, it says it's for our staff, the posters are displayed in all our offices, in all staff offices, as well as communities. So the audience is also communities, so that they can start, noticing it, what's right, what's wrong.
We can't hit, in the original, in the child safeguarding policy, it says you can't hit something or physically abuse a child in any way. When I was in this one country program, I said, what do you think that means? What kind of hitting takes place here? How are people punished? And they said, they named a bunch of things, pulling ears, pinching, what. And the kids all started laughing and saying, St. Children isn't allowed to pinch us. I said, no. Why? Are you saying it? And they were all laughing. I said, we get pinched all the time by St. Children. Oh. And so, but it wasn't like directly spelled out in the rules. And so you need to talk to them about, what do we mean by physical abuse, and really get them to understand. And so you get so much information by having this dialogue with kids. And we did deal with the pinching. Apparently they were being pinched because they were misbehaving. But part of it was because the staff didn't know how to discipline them. So we have to also do training with our staff on how do you discipline children who are misbehaving, and what do you do? The staff really didn't know what to do, and they felt like, they said pinching was kind of a quiet alternative to beating.
Now, I'm heading up the revised SCI Code of Conduct. Do you want to say anything about that?
No, it's basically the same as Save UK. It's like essentially the same code of conduct. But what we noticed yesterday when we were going through it is that if they have omitted the reporting obligation, the old Code of Conduct had a clear statement that, the old Save the UK Code of Conduct had a clear statement saying that it's mandatory to report any concerns. And somehow it's gotten dropped. It was the very last bullet point, and I wonder if the printing press kind of took it off. I have to bring it to the attention of SCI. I just actually realized it last night. So you do have a mandatory reporting requirement, and not reporting is a breach of the policy and of the Code of Conduct in itself. So it's not on there at the moment, but it is a requirement.
And lastly, child safeguarding responsibilities for specific reasons and work plans to make it happen.
Thank you.
And I'm not terribly familiar with this, so if you want to say a few words about the document.
Yeah, it's actually similar to Bertrude's document with the objectives. In fact, I think that it might. I think I like to take this one and take it into like a similar kind of format, because this is. These are responsibilities that different levels of posts could have, like what an IT person could do, what a senior manager could do in terms of child safeguarding. So not just the standard statement, you have to uphold the policy, which is really a contractual statement, but actually I've tried to give responsibilities to different kinds of posts so that people get an idea of how they can, apply child safeguarding in the work that they do. And I think that's actually quite important, because at the moment a lot of people see the child safeguarding policy only in terms of their own personal conduct, not in terms of how they can bring it into, how they can integrate it into their own role, into their own program. So this is a guiding document for that. But I kind of like how you've done the layout of putting it as a work plan thing. I think that might make it. Because I think people like to just cut and paste stuff. So I think it'll make it easier for people who are doing their work planning. They can just like...
Yeah, exactly.
Could I just comment or ask something? I'm just seeing the issue of child participation. That in SCI you don't have a child participation clause.
Yes, we're going to put it into the standard, into the MOS. It's a good point. Yeah, so they have, because Save UK did have a child participation policy which made it very clear on what you're supposed to do to keep children safe if you're running events, and that no longer exists. So it's going to go into the MOS standards, so like a whole separate section on safe child participation. So yeah, good point.
Great. Do you have further questions or comments, or is it all right to bring the session to a close and thank Christine?
Thank you, Bertrude, for running my session.
Christine, for coming. And yeah, I mean, it's really great. What a wonderful coincidence that you are in London and we could have you and you could spare your whole afternoon.
Thanks for
your
asking me.
precious time. Yeah, no, absolutely. Thanks very much.
It's nice to meet you.
Nice to meet you. And yeah, I'm very, I think that the role that you guys have is so critical to child safeguarding, and the link that you have with your child safeguarding focal points. And sometimes it's the same person. I think, are any of you child safeguarding focal points as well? Okay. Because there is a very strong link between accountability and child safeguarding, which is why Bertrude and I are working quite closely on integrating it. So when you go back, it'd be great if you could talk to your child safeguarding team members about that.
Okay.
Thanks, everybody.
Thank you. 10 to 5. Will we take 10 minutes to do a reflection on the day, and then